Good morning, everyone. We will get started now. Thank you very much for attending today. We really appreciate that. On behalf of the entire team at Pegasus Institute, I would like to welcome you, and we'll start today's meeting with our land acknowledgement. We acknowledge that the land on which we gather is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Atiwandering, the Haudenosaunee, and the Wendat peoples. This land is now the home to many diverse First Nation, Inuit, and Métis peoples. This area in Mississauga is covered by Treaty 13A and Treaty 22, signed with the Mississaugas of the Credit, and lies within the lands protected by the Dish with One Spoon Wampum Belt Covenant, an agreement to share and care for the resources in peace and mutual respect. As we gather, we honor the enduring presence of Indigenous peoples on this land, recognizing their elders past and present, and commit ourselves to the ongoing work of reconciliation and stewardship. Thank you again, everyone, for attending. Before I pass the microphone to my colleague, Saida, I would like to apologize for us. We have had some issues that we could not integrate French translation into this meeting, and we promise you we'll try our best to incorporate it into next time. Thank you very much.
Thank you, Mohammed, and good morning, everybody. Firstly, I'm Saida Azam, and I'm the project coordinator at Pegasus Institute, and I'm an IMG myself. So this event is, I know the importance of this event and how valuable it is going to be for all our audience here. So, so it is my pleasure to welcome everybody here for our IEHP hybrid seminar and job fair for the year 2024. And we sincerely appreciate everybody who is present here, either in person or virtually, who's trying to gather as many resources and information as possible to progress in your career and also give back to the community one day. And at this point in time, I also would like to thank our sponsor, Canadian Medical Foundations, and who are also our partners, who has been instrumental in supporting us through the entire process. So without their support, we wouldn't be here. So we really would like to appreciate them for that. And so today's agenda is packed with sessions that will provide everybody with an opportunity to connect with valuable leaders here in this particular domain, and also with other recruiters and other peers who are going through the same process. And so I would like to thank everybody here for that. And before I would proceed, I would like to welcome Dr. Janet Zauza. And I would also like to briefly, I would like to briefly introduce about her as well. So Dr. Janet Zauza is a family physician. I'm sorry, am I pronouncing your name right? D'Souza, I'm so sorry about that. She's a family physician with a focused practice in dermatology. She's an avid public health advocate and an inclusive leader, valuing and respecting the vast perspectives that people from different cultural, educational, religious, and ethnic backgrounds bring to the table. She is committed to the continuous growth in herself and in others, which is amplified by continuous participation in leadership development and collaboration with fellow healthcare professionals. Her vision extends beyond clinical practice. Dr. D'Souza aims to influence policy decisions to increase and improve the healthcare workforce capacity and capability. Additionally, she inspires colleagues and internationally educated health professionals by guiding, shaping, and motivating them in their own healthcare journey. And I'm proud to say that I'm one of the IEHPs who has been inspired by her. She is one of my mentors as well. So I'm really, really happy that she's here today. Her goal is to foster a more inclusive healthcare environment and stimulate a new wave of healthcare leaders who are resilient and robust. We are honored to have you here, Doctor. Thank you so much for participating and helping us through this process here. So thank you, and I enjoyed the seminar, and I pass the stage on to Dr. Janet.
Thank you, Saida, for the warm welcome.
Thank you.
Good morning, everyone, and welcome to the inspiring Pegasus Institute Hybrid Seminar and Job Fair. I'm Dr. Janet D'Souza, and as Saida has already introduced me, I'm an internationally trained physician who navigated the challenging terrain of requalification, licensure, and certification to have successfully transitioned into the Canadian workforce. As a practicing physician now, I am motivated to be involved as a part of this ambitious project to help you as internationally educated health professionals, whether you are physicians, dentists, pharmacists, nurses, nurse practitioners, or allied healthcare professionals, to advance your healthcare journey and integrate you into the Canadian healthcare workforce. In Ontario and in Canada, as many of you can attest to, we have struggled to recruit into this country highly skilled, internationally educated health professionals. Once you arrive here, we continue to face challenges to actually successfully integrate you into the workforce. As many of you may have already experienced, it is equally challenging to get integrated into a field of your chosen area of expertise. Michelle Genet, a creativity author and speaker, is credited to have said, networking is not just about connecting people. It is about connecting people with people, people with ideas, and people with opportunities. So on behalf of Pegasus Institute today, I am so proud to invite you to such a networking institute and such a networking opportunity. And we thank everyone involved in small ways and in big ways to be here today and to make this event happen. We also value each and every one of you who are participating, whether in person or virtually, because we believe that you provide us with the necessary steps to strengthen Canada's healthcare workforce and to help address critical workforce needs. Lastly, what we hope to achieve today is to help give you the necessary career development goals and tools to help you with expert insights, to give you perhaps the networking opportunities today to build on in the future, to illuminate your pathway to licensure and requalification, and to help ease your integration into the Canadian healthcare workforce. A wise man once told me, the longer you speak, the less inclined people are to listen to you. So without further ado, instead of rambling on today, I'm going to pass the mic to our first guest speaker, Ms. Kate Agar. Ms. Kate Agar is a highly experienced language educator with a career spanning more than 15 years in varied academic environments. She has taught in private institutions in Toronto and in newcomer-focused programs such as the Niagara's College's ELTE and OLT initiatives, holding an English language literature degree from Lakehead University and a Master of Education. Kate is passionate about helping internationally educated health professionals build vital English language communication abilities. Her expertise lies in guiding healthcare workers to developing proficiency in medical vocabulary and to convey intricate ideas clearly and succinctly, ensuring both empathetic patient care and effective professional exchange. I can hear myself echo. She has designations including MED, OCT, OCELT, and is devoted to supporting students as they advance their careers in Canada. Welcome, Kate.
Good morning, everyone. It's a pleasure to be here, and I do hope that you find my session informative, as it is focusing more on communication skills and specifically cultural competency within the healthcare field in Canada. Okay. So let's take a look at the agenda for my presentation today. We are focusing on communication skills in the healthcare field. We're looking at statistics when it comes to internationally educated health professionals and what the numbers look like within the healthcare sector in terms of job opportunities. We'll then focus more on how necessary it is to build up and improve our communication skills so we can effectively integrate into the opportunities that are given to you within the healthcare system. 1 second. Got it. All right. So I'll just kind of tilt my head up once in a while to help myself here. So understanding the healthcare job market, this would be a #1 concern for us, right? Is knowing where the jobs are and then how to find these jobs. In addition, effective communication skills, navigating interviews, and networking strategies. So these are a few points that I'd like to discuss today. When looking at the healthcare job market, the statistics tells us that in 2021, there were approximately 259,695 internationally educated healthcare professionals. That's a big number. But what we need to keep in mind is that we still need more. We understand that there's a need for healthcare professionals. And even though the journey may be challenging, you are in the right place here to learn more about the opportunities given. So here was the statistics. They're there for you, okay, just to kind of give you an overview of what it looks like. That in fact, there are a lot of internationally trained healthcare professionals within our healthcare system already. The message is that despite the challenges that you might face today, it is not impossible to build your career here. You need to see the light at the end of the tunnel. I encourage you to work hard because the opportunities are there. And on the next slide, you will see the numbers reflecting on what the backgrounds of internationally educated healthcare workers are and in what fields they're currently employed. So the numbers do speak for themselves, that there are plenty of opportunities. Finally, the challenges you're facing are, of course, difficult. They're not easy to overcome, but they're not impossible. Some of the challenges include licensing, right? Not maybe having to do more education, having to study more here, but there are appropriate pathways for you, and you can, in fact, get employment. The outlook, based on the job profile from the job bank website, suggests that there will be jobs. The outlook is good for employment opportunities in the healthcare field. And some of the factors include aging population, people retiring. So demand will be there. And that is the one thing that I want you to keep in mind because the opportunities are there. Now, effective communication. This is what I'm here to talk about. Effective communication is important, and it starts from the very beginning. It starts from your job search and your job applications. Whether you do it by email, through Indeed, through LinkedIn, whatever avenues you use to apply for jobs, effective communication is number one that employers are looking for. And when it comes to first impressions, they matter. It is essential for you to understand what the employer is looking for when it comes to communication skills. And that impression, that first impression comes from your resume, your cover letter, and the first email you send to a potential employer. That's how they judge and know whether or not they want to invite you as a candidate for an interview. You got to get through that first hurdle first. And to do that, I advise you to use the resources within your community that can guide you in building effective resumes and cover letters. Additionally, you want to make sure that you effectively showcase your skills on your resumes and in your cover letters. Because without matching the skills to the jobs that you're applying for, there's a gap. And the employer might not be interested in looking at your resume. You have to find the right balance. And again, to do so, you can lean on your community organizations, you can lean on your language instructors or professors in institutions where you're taking courses, and they will help you to do that. Demonstrating professionalism in all areas is key at all times, whether it's employment-related communication or it's communication with service providers. You demonstrating professionalism 100% of the time will get you far. The reason is you're networking when you're communicating with people. You're networking when you're reaching out to your local organizations to help you with job search, to help you with language skills. And that communication, that professionalism is key in building the relationships with others and being successful. Tailoring to the job, we want to make sure that we present ourselves for the jobs that we're applying for, right? We want to make sure that we match what the job is looking for, right? We're not overqualified, nor are we underqualified. So it's a balancing act. So your first impression comes from your initial communication with the employers, and that's what kind of gets you where you need to be. My second point is navigating interviews. That's where communication matters as well. If you have experience attending a Canadian job interview, you understand that we don't ask simple questions. We don't ask questions about what is your educational background, or how many years did you practice medicine, or how many years have you been a nurse. Those questions are not essential. We get to know you, but they're not the questions that interviewers often are listening for. The challenging questions are behavioral questions, case studies. What would you do if, right? And these are the questions that demonstrate your communication skills. Because I know it's easy to say, well, this is my experience, this is my education, this is what I did for the last 30 years. We can all say that. But to demonstrate that you are effective communicator, it comes from some of the more challenging, as I said, behavioral questions. You always want to come back to your skill set. You want to match your skills to the questions the interviewer is asking you. Body language is on the list of things that I see on my PowerPoint, and body language is important. That's where cultural competency comes from or comes in, right? This is where it is important. Understanding gestures, understanding facial expressions and what these tell us, or what message do they send to the person whom you're speaking with. Our body language is more important than the words that we speak. And we have to keep that in mind. And that is something that you want to keep in mind when you're thinking about, am I effective? Am I good at communicating what I want to communicate? Handling difficult questions, that was part of the thing I already mentioned. Follow up. How many of you follow up after an interview? And what does that mean to follow up? How often do we need to do it? And why do we need to do it? I'll tell you a little anecdote from my own life. And I was at a job interview for McMaster University, and I never really heard back from the administrator there. I ended up following up twice, and I ended up getting the job. Not because the administrator didn't want me, and that's why she didn't, respond to me. The reason she wasn't contacting me is because she was busy. The program got put on hold. And without my follow-up, I don't think I would have been successful, right? So culturally, again, navigating the interviews, follow-up after the interview is one of those essential things that we need to keep in mind as part of our communication. Networking strategies. I'm good. Okay. Networking strategies. Attending events like today, all right? Connecting with one another and also connecting with your community organizations is key. Building genuine relationships. Not building a relationship because you know you're going to get something out of it, but building a sincere relationship within your community, within the opportunities that you're given, and staying in touch with one another. Stay connected on social media during networking events, information sessions, and professional groups. Be active in the community where you want to be employed. I didn't mention volunteering, but while volunteering is one of the core things of Canadian society, and we value it so much. And there's so many opportunities not only to volunteer, but then they also grow into something bigger, something that can help you become successful. Now, these were all related to job searches, job strategies, and how to help you navigate that. But let's focus a little bit more on communication culture in the healthcare sector. The way we communicate is not universal necessarily. As much as healthcare is universal, right? What you learn in healthcare field, what you do in healthcare field is universal, but the way we communicate is not. So, norms and expectations. You need to understand norms and expectations within the Canadian healthcare sector. And also focus on cultural sensitivity in communication. If you look around the room today, you will see different cultures represented, different languages, different values, beliefs, religions. And we always have to keep that in the back of our minds. When we're communicating with one another, we have to make that a priority. So let's take a quick look. All right. So norms and expectations within the healthcare field. I'm sorry, I just got distracted for a second. Patient-centered communication, all right? Now, you will see patients from different cultures coming to see you. And it would be your responsibility and your obligation to make that person feel comfortable, no matter if you share the same background, And that can be a challenge. If you have practiced in a one culture setting where it wasn't as multicultural as it is in Canada, keeping that in mind is very important in being successful and successfully practicing in the field. Working with others within the field is key as well, right? Understanding that you are not the only one person working with a client or with a patient, that there are other people involved within the team setting, whether it's specialists, whether it's nurses, whether it's technicians and other workers. We have to be a part of the team, and that will make you effective and successful in getting where you need to be. Documentation standards. I've heard so many times my students telling me how documentation standards are different here. I recently had a student tell me that in her job, she would delay documenting things and rather focus on the patient, but that's not what's expected of you in the real world, right? And it's your ability to adapt and your ability to follow what is expected is essential as well in being successful. Additionally, formal and informal communication, right? Understanding the difference between when we need to be more formal and when we need to be a little bit more informal will help you become successful in your field. And finally, context, right? We always have to keep in mind the context. Nobody can read your mind. No one. And you have to give enough context to each person with whom you're speaking so that way they can be connected with you, so they can understand where you're coming from. Context works in networking as well, right? So if I met you at the conference today and 6 months later I come up to you and say, hey, how's it going? You might not remember. But if I give you a specific context and say, I met you at the event on Saturday, November 23rd, I was a presenter, you were attendee, does that trigger something in your mind? Yes, it does. Does that make you feel more connected? Yes, it does. And that's what I mean by context. So that's important in communication as well. Cultural sensitivity. Again, I come back to the same point. We're all coming from different cultures, and we have to put that aside. We have to see each other as human beings, not as you identify with this religion, this background, this language, this culture. No, when it comes to cultural sensitivity, it means that we are treating each other on a human level. We're putting our differences aside. We're going beyond our own things and norms that we have in our heads. Because I always say to myself, what is normal to me has been shaped by where I grew up, has been shaped by the schools I've attended, and has been shaped by the family and how they raised me. None of you have the same experience as me. And therefore, what is my normal is not your normal. And we have to remember that every single time we interact within the multicultural community in which we live. And we're becoming more and more multicultural day by day. The cross-cultural communication, again, it can be challenging because sometimes it's so easy to fall into our own language, our own culture, and want to be connected with our own people. And I don't fault you for that. And I think it's great that we can do that in Canada. But we also have to balance it. We also have to come out and say, listen, I'm going to challenge myself, and this is the way I'm going to improve my communication. I'll tell you a non-health related story, but I have a student of mine who is working with 6 people in his company who are from the same language background. This person can survive without having to speak English ever. But why? Why would you do that, right? It's great that we can do that, but to integrate and to build community for yourself and to be a part of the community, we need to open up and say, listen, I'm going to integrate and I'm going to use my expertise and bring it to this culture. And that's through communication. That's done through communication. All right. Last little bit here, managing healthcare interactions professionally. So best practices for verbal communication, best practices for written communication, and culturally sensitive communication. All right. So when it comes to verbal communication, English is not my first language. It might not be yours. That's not a problem. Don't make that a problem. Believe that you can communicate effectively. Even though you might struggle today, it'll get better, okay? And you want to be clear. You want to be brief. And we don't always need to speak for, an hour, 2 hours, or 3 hours, but as long as we can get that message across clearly. I find myself, when I was learning English, I would always think, I want to say these long words, beautiful sentences, use all of the verb tenses that I've ever learned. But that's not real. That's not real communication, because the more mistakes I make by making it too complex, the less effective I am. So I've learned to take that back and say, Kate, listen, use simple present tense, use simple past tense. People will understand you better. It doesn't mean that you're less, because you're more effective that way. And believe me, English is not an easy language to learn. Tone and pace. You gotta slow down once in a while. You gotta pause and let people understand and process what you're saying. I teach that to my students because from some language backgrounds, we tend to speak very fast, we get excited, and we really want to get the information out there. The faster you speak does not mean that you're more accurate or more effective. You gotta step it back. You also have to understand your audience and whom you're speaking with. Does your audience have the capacity to understand that fast rate of speech, right? We have to be mindful of that. Nonverbal cues, always. Only 7% of what we say is through words that you understand. 93% comes from my body language and the tone of voice. In healthcare, that matters, because you need to be empathetic. You need to be compassionate. You need to be welcoming and caring. And not your words, but your body will get that message to me. And you have to be mindful of that at all times. Active listening. I want you to think for a second, or go out to a mall this afternoon perhaps, and observe people. Look what we're doing. We're attached to our technology 24/7. That's not active listening, right? What I'm speaking about when I say active listening, it means we are here, present in this moment, and I'm not listening to respond to you. I'm listening to understand you. And in healthcare professions, it's the most important thing. You can't listen to respond. You have to listen to understand, and your body language will tell me whether or not you're listening, right? Your body language will either make me feel like I need to tell you more because you're paying attention, or it will tell me, nah, I not communicating here. You're not listening, so I'm just not going to say what you need me to say, right? So we do want to be mindful of what our body does when we're listening and how we're listening. And empathy is key. When it comes for written communication, documentation. Documentation in healthcare is essential. Okay, this is something that you'll learn through practice, by taking courses, by looking at YouTube videos, by reading policies and procedure manuals at different organizations. But your writing skills are also important, right? And there's specific requirements within different professions. For example, in my OSLT classes, I teach nurses how to use clip structures appropriately, right? How to document things using the standards that are acceptable here in Canada. Because documentation in other parts of the world may not be the same. It might not translate into your Canadian work experience. But this is something that we do here, and this is something that I encourage you to learn about. We definitely want to be accurate in our documentation and in our written communication, especially within the healthcare fields, right? Accuracy is key, but also giving the information that is needed, not the information you think is important, but the information that is in fact important. So there's a lot of things that you need to do and learn to do and practice doing to make sure that you are effective in written communication forms as well. Take a look at the image of culture there for a second. There's a few things on it. Clothes, customs, food, practices, behaviors. Culture is a lot of things. And as I mentioned earlier, being culturally sensitive is important because it will help you to build rapport with your patients. Because you want your clients and your patients to come and see you again and again and again. You want them to be confident in your skills and abilities. And how do you do that? By building rapport, right? And to build rapport, we want to be flexible in our own minds to allow the person to feel comfortable with us. Now, inclusive language. So our society is changing. Our understanding of norms is not the same as it was in 1920s, 30s, and 40s. What we accept today, we may have not accepted in the past. And we, as educators, as healthcare professionals, we need to grow. As the language grows, as the society grows, as it changes, we need to accept that so that way we can change as well. It could be as simple as the use of pronouns. That might not be something you're aware of, but something you might want to learn about, right? That's cultural sensitivity. That's understanding the culture. Inclusive language is key. Whether it's, again, language that is gender neutral, or generally it's more inclusive. It allows the people that you're working with, both your colleagues and your patients, to feel that they are valued, because we all want to be valued, I think. Finally, difficult conversations and culture sensitivity. How we navigate difficult conversations is going to be different from your personal experiences, but also from your language and communication abilities, right? Many times, one thing that I have struggled with, and I see my learners struggling with, is direct versus indirect communication. How many times have you gone to a Tim Hortons as a brand new newcomer just arriving at Pearson Airport and saying, I want coffee. Well, you do, yes, that's wonderful, but that's not the way we communicate. Could I have a coffee, please? I would like to have a coffee. Those are basic, simple examples, but these are things that matter. That grammatical structure changes the way your question or statement is perceived. It might sound useless and time consuming or whatever else we want to call it. It's challenging, yes, but it's important to understand that we need to use these different structures that may not translate directly into your own language, the same way as I want coffee would translate. And these are key. These are little tiny bits and pieces of information that we have to always be mindful about. All right. In summary, we looked at communication as a tool to access the healthcare job market. I focused on written communication through cover letters, resumes, job applications, okay? And how you need to make sure that it meets the Canadian expectations, that it meets the requirements, but also matches the skills that of the jobs you're applying for. Second part, I talked about communication culture in healthcare sector, right? And we looked at being culturally sensitive and understanding the diversity within our society and being accepting with this. When I say accepting, I don't mean we have to agree or disagree on everything, but we have to be flexible and be able to adapt to the diverse society we currently live in. Managing interactions professionally. Professionalism is what will get you very, very, very far in any career you choose. You have to have high expectations of yourself in every moment when you work, when you interact with people, whether it's outside of work, whether it's in a volunteer opportunity or at a networking event. You have to hold yourself to very high standards, and that will shine through. You will be noticed, believe me. Finally, I do want to bring your attention to an overview of a few language programs that are available to you. And I put 3 pieces of information there because you have your community ESL programs, right? These are often offered within the multicultural centers and they could get you started. So if you come in at a lower language ability, that's okay. The community ESL programs are there to help you grow your language skills. There are college EAP and ELT programs, and these are often more academic based, okay? And sometimes you will need that academic English to get yourself into the next program that you want to study. For example, representing Niagara College, I will say that we offer an ELTE program, which is free for newcomers. It is a government-funded program that has one course that meets the English language requirement for you to go and study at a college. That's just an example from Niagara College, but I trust that there are other colleges that offer something very similar. But most importantly is the OSLT courses. And OSLT courses are geared specifically for your occupations. They're called occupation-specific language training. And there are 3 occupations that we focus on: business, technology, and healthcare. I have taught all 3, and the most rewarding one is the healthcare field, because I can see that the opportunities that we offer within our OSLT programs allow the newcomers and the IEHPs to connect with one another, to connect with employment opportunities, and to build up skills that you can be successful. Before I close off, I will say this. In my spring term this year in the OSLT health course, I had several students who secured jobs while they were studying with me. Is it my accomplishment? No, it's not. But I do know that the connections my students have made through the opportunities provided by the OSLT program allowed them to secure jobs. I'll say to you that I had a pharmacist who doesn't have any Canadian credentials get a pharmacy assistant job. Is it the same? No, I understand it's not, but it's in the field. It's a step forward, right? And she's not the only one. I have had plenty of nurses graduating from the OSLT courses and pursuing their careers in nursing because the OSLT program allowed them to think and see things clearly to build the pathway, right? The courses help you with the language skills, but they also help you to stay connected with community organizations, service providers, employers, and everyone else who's here to help you and assist you in getting where you need to be, in helping you to get where you want to be. So I do appreciate everybody being here and listening to me. I hope you take away a few things from my presentation. I will say that communication is, in my eyes, the most important skill that you can have. However you communicate, whatever language level you have, communication is a transferable skill that will get you the job, that will get you the career, that will help you to be what you want to be here in Canada. And I will say this, it is difficult, but it's not impossible. Thank you. Are there any questions for me?
Thank you, Kate. I certainly know that your communication and presentation has added so much value to my day. Thank you. And I'm sure that it has that same impact on all of you today. Thanks again.
You're welcome.
All right, thank you so much for, of course, taking this opportunity to present to our participants in the program. And of course, ensuring that they do understand the value of culturally sensitive communication, especially in healthcare where you have communication can be so diverse. We really appreciate the time and effort that you've taken out of your very busy schedule to be with us today. All right.
Thank you. Thank you for having me here. Thank you. Thank you so much.
Thank you.
Today, at this moment, we have a recruiter spotlight, and we will be highlighting the Correctional Services of Canada Health Services Unit, which is the largest employer of health professionals in Canada's federal public service. This includes employees in a variety of health care disciplines, including psychologists, primary care physicians, and nurse practitioners, registered nurses, social workers, occupational therapists, and pharmacists. Health professionals within CSC provide a range of healthcare services to federally incarcerated residents using a patient-centered interdisciplinary care model. Licensed health professionals offer essential health services, assessment, intervention, treatment to a diverse patient population. At this time, we would like all of you participants to take the opportunity for 10 minutes to interact or intermingle with the recruiters And please come back in 10 minutes for our next guest speaker, who will be speaking to us about pathways to practice for IMGs in Canada. So please come back at 11:05 a.m. Thank you.
Okay. So we do have light refreshments for you all. So if it is that you would like to have some coffee or tea and some snacks and fruits, we do have some volunteers there. They can direct you to where we have those available for you. We can get on with some more of that networking.
So welcome back as we introduce today our second guest speaker, Miss Irina Edilova, who will be speaking to us about the pathways to practice for IMGs in Canada. I respectfully request that you grab your seats. We will have the opportunity to network afterwards. Ms. Irina Edilova has over 13 years of experience supporting internationally educated health professionals in their journey towards healthcare integration in Canada. She has guided thousands of internationally educated health professionals across Ontario and beyond, offering both group sessions and personalized advice. Notably, Ms. Irina has assisted over 600 international medical graduates with successful CARMS applications, which all of you know are a vital part of our process towards getting a residency. She served on the CARMS Application Review Committee from 2016 to 2018 and has worked as a health workforce integration advisor with Healthforce Ontario for 8 years. She has held the position of Internationally Educated Health Professional Advisor at Ontario Health for the past 5 years, where she continues to be an invaluable resource for internationally educated trained professionals, especially IEHPs in Ontario. Welcome, Ms. Irina Edilova, and thank you for being here today.
Yeah, I'm not saying I'm technologically challenged. It's just been 5 years online work in front of the screen. I would respectfully everyone to finish both conversations because the session has resumed. Thank you so much for coming here today. It's a wonderful opportunity to finally get out of a shell of an online at-home remote work since March 2020. And thank you, Pegasus Institute, for bringing us today here. I'm really excited to see some of my colleagues in other organizations. Love the presentation of Kate that she did before me. And also, you should expect a very good presentation by Mihai Chaki. Will be at 12 o'clock. You will not regret, I guarantee. The same way, please, I really, really would like attention if you're here. You're here for the reason, right? So, I'm a little bit nervous because I haven't spoken. I know that it's very, very, I would say, attentive, but small number of IMGs today and more online, more online. And as Kate said, it's not even about getting the information. It's about connection. So therefore, kudos to everyone, each of you who are here today on Saturday morning, driving here, asking your better half to drive you here, maybe like my husband waiting on the parking lot for me. So really, really, really grateful, and kudos to myself, saying yes to in-person rather than online presentation. All right, so as Janet said, I am IHP advisor since March 2011. So March next year will be 14 years I work with IHPs at former Health Force Ontario, now Ontario Health. Health Force Ontario is part of Ontario Health now. It's much, much, much bigger. And I work mostly with IMGs. And I know that you came probably today for networking and getting the job opportunities. And my session is about licensing. Why is that? Why is that? The reason for this session usually is good to be included because if you're a doctor for life. And 99% of you who come to Canada, you want to be doctor again. That's my 14 years of experience tells me. So this is your plan A, and your plan B is everything else, which is good because you have to have plan A, B, C, and D, right, to be successful. Canada is a wonderful country, but you need to have a job and good income to enjoy these wonders, right? So anyway, yes. You see, I said I'm not technologically challenged, but I need some advice. Anyway, licensing options for IMGs and ITPs, and immediately we're jumping into the acronyms. So, and, it's not working. Look at this. Or maybe I have to. Next slide will be acronyms, and here they are. IMGs, International Medical Graduates, ITPs, International Trained Physicians. So usually we use IMGs and ITPs interchangeably, but more and more we are using the doctors who already have practice experience like ITPs. So in my presentation, you will hear Medical Council of Canada, CFPC, Royal College, CPSO, CARMS, MCCQE1, NAG, BC-CAP, CASPR, FM Pro C, MLP, IMG. I'm not going to read all of them. PRA, PER, and CEP. So these are all acronyms that are related to the IMG licensing pathways. So, as mentioned, I'm not a doctor. Please don't call me Dr. Edilova and Dr. Irina. My background is in education, but I love working with doctors, really love. I think that you are the elite of each nation, and you are the elite of our Canadian society as well. So that's statistics from March 2024, how many people. I know personally who went into the system as doctors through different pathways. It doesn't mean that they are doctors because of me, not at all, but I'm proud that I contributed to their success. Well, before we talk about licensure paths, we need to understand what kind of organizations are involved. And the major players are Medical Council of Canada at the national level, and the function is to conduct qualifying exams. Please note, Medical Council of Canada does not issue license for you to practice. And therefore, when you get the LMCC, Licentiate of Medical Council of Canada, it does not mean that you can practice, not at all. But they administer qualifying exams and also the clinical exam that's called the NAC, National Assessment Collaboration. Royal College of Physicians and Surgeons of Canada, Royal College, also the regulator at the national level. And their function is to accredit all specialties, all 80 specialties and subspecialties across Canada, and also conduct certification exam. In Canada, we don't call the board exam. We call certification exam, but it's the same. So the Royal College is the board for specialists. For specialists, you are a pediatrician, psychiatrist, surgeon, gynecologist. The Royal College is your board. Okay, so certification exam is your board exam. The College of Family Physicians of Canada is the board for family doctors. It's also regulated at the national level, and their function is to accredit family medicine programs across Canada and also conduct certification exam for family doctors. And at the provincial level, the regulator who actually issues the license to practice, it's called, like general name is Provincial Medical Regulatory Authorities, but for each province, their own authority. For Ontario, CPSO, College of Physicians and Surgeons of Ontario. For Alberta, CPSA. For Saskatchewan, CPSS, and so on. CPSBC, CPSNS, CPNL, CPSNL. It's only Quebec that has it in French, CMQ, Collège de Médecins du Québec. But the regulators that issue the license. So these are the stakeholders, and I will be. Okay. Wow. Oh, that's really exciting. Yeah, anyway. That's okay. That's okay. It's just that's part of being out here in this world, you know, like physical world and experiencing like with all the senses, right? Anyway, so I will be using these names a lot during my presentation, and you need to understand them. So another thing that's fundamental in understanding what it takes for you to get the independent license is that you have to pass 2 sets of exams. One set is qualifying exam, and another set is certification exam. So this is on the right is my simplified formula. Okay, so I think, can I use this? No. I was hoping that I would be using all this, you know, like little dot, red dot, but I guess that's okay. So what you will see, this is my simplified formula for you to better understand what it takes to have independent license, which is your goal if you want to be a doctor. I want to practice with independent license, ideally in your primary specialty, right? So you need to be Canadian citizen or permanent resident. You need to have the Licentiate of Medical Council of Canada designation, and you need to have certification with either Royal College or CFPC. So 2 sets of exam. Qualifying exam is a QE1, Medical Council of Canada Qualifying Exam Part 1. And for this exam, they are testing your medical knowledge and clinical skills. Who is eligible? Anyone who finished medical school, anyone with medical degree. Of course, that's the medical school has to be in the list of medical schools. So with no problem with eligibility. That's why if you have 1 year of postgraduate training in your home country, let's say internship, and pass QE1 exam, you get LMCC, no problem. What is LMCC? It's just a paper, you can put it on the wall. Can you practice with it? The answer is no. Why? You need certification exam. You need certification with the Royal College or CFPC. And this exam tests your knowledge and skills in the particular area, in the particular specialty, either family medicine or your specialty. And you see, I put eligibility in red and with 3 exclamation marks. Why so? Because this is the bottleneck is. When you hear the sad stories about IMGs driving Uber or working as a night guards, is the reason that they did not have access to certification exam. They may have OMCC, they may even have their years and years of practice in their home country, but they don't have eligibility for license for certification exam, and here they are. Most licensing issues for IMGs have to do with the lack of eligibility for certification exam. And that's why your pathway to medical license is basically your pathway to have access to this certification exam. You got it? So you need to know what you need to do, what are the ways to get access to this certification exam. And for that, we have 5 pathways. Here they are. Jurisdiction approved training, postgraduate training in Canada, you have to apply through CARMS, practice ready assessment programs, practice eligibility route for specialists only, and there is a very specific program in Manitoba that is called Manitoba Licensure Program for IMGs, MLP IMGs. And that program is for GPs and family doctors. These are for full medical licensure. But you see in that orange part or yellow, there are also a couple of medical license options in Ontario that doesn't have full license, but allow you to practice with independent. It's academic license, and I want you to understand what academic license is, and also subspecialist affiliate status license. And I also want you to understand what it is. Maybe you are qualified for that and you just don't know. Anyway, let's talk a bit briefly about jurisdiction approved training, and I will explain you the reason why I include it in my presentation. Well, the Royal College will give access to certification exam immediately after assessing your postgraduate training if your postgraduate training is done in Australia, New Zealand, Hong Kong, Singapore, South Africa, Switzerland, Ireland, United Kingdom, and United States. So those specialists, basically most of them immediately have access to certification exam. You remember, I said, the bottleneck is access to certification exam. So these countries, they immediately do. Why so? Because the Royal College compared their postgraduate training and they say it's very, very similar. That some IMGs do USMLE exams and apply to residence in the United States. Have you heard about these cases? And that's exactly for this reason they're doing it. Exactly. Because once you finish your residency training in the US, you can come and work in Ontario. You don't need any extra exams. Once you finish, you got your license certification in the US, off you go. You can work with the restricted independent license here in Ontario. Not full. Like for full, you need a little bit more, but you immediately can do that. For family doctors, there are only 4 countries: Australia, Ireland, United Kingdom, and the United States. Okay? So over 14 years, I have the clients who very disappointed with the system here, decided to do family medicine training in the UK. So they do PLAB 1 exam, PLAB 2 exam, they get into the training there, off they go, they come and they work as family doctor here in Ontario. I'm just saying that that is what IMGs are doing because that option exists. And there are also some of the specific programs that Royal College recognizes, and they're accredited, which means that if you, let's say, finish internal medicine training in that university in Chile, or internal medicine from this to this year, Kazan University in Russia, or anatomical pathology, surgical foundation, pediatrics in Kuwait, or neurology and psychiatry in Saudi, you are in the same boat. You are in the same boat. You have access to certification exam. Okay? So this is the first pathway. Now, you are not from approved jurisdiction. You came from the country that training is not recognized. What should you do? Well, there are other options, and many IMGs choose to do residency training in Canada. And by the way, this week and next week are very, very, very important weeks for the IMGs. Well, first of all, CARM's application deadline is 29th of November. And we are 3rd November, right? Next week. Secondly, Practice Ready Ontario program, the cohort number 3, just getting their letters of acceptance. Yes, they accepted. Yes, they are going to the assessment. They are excited, new things. So they will be doctors in 3 or 4 months here in Ontario. And the third event is that yesterday, applicants to the Manitoba program received their letters about being shortlisted for their first interview. So they are one step closer to being accepted to the MLP IMG. So I'm really super excited. Anyway, postgraduate training application is happening through CARMS, Canadian Resident Matching Service. Who is eligible? General eligibility is pretty simple. Recognized medical degree, Canadian citizen permanent resident status, QE1, NAC exam, and language proficiency. Basic eligibility. However, some programs, some provinces have additional requirements. For example, you want to apply to UBC, British Columbia programs, or you need to have additional test. It's called BC CAP, Clinical Assessment Program. You want to apply in Alberta to both universities, University of Calgary, University of Alberta. No, you have to be a resident of Alberta and you have to pass the IMG assessment there. Additional requirement. And if you want to apply in Quebec there are 4 universities, 3 of them French speaking, 1 English speaking programs, McGill. And you don't need to be a resident of Quebec, but you need to speak French. For sure, for French speaking, you need French fluent, like French test. But McGill doesn't require French test. McGill doesn't require even English test. When you go to the interview, they will test your French because your patients, when you are resident, will be French speaking, but it's not a requirement. But they need to ensure it's kind of equivalence of Doctor of Medicine degree from Collège de Médecine de Québec. This is a paperwork. You pay $500, you submit their medical degree, they check it and say, yes, off you go, equivalency letter. It's the same what you do with Medical Council of Canada when you send it for verification. So you do the same for CMQ. So these are 3 additional requirements from the provinces when you apply to residency through CARMS. Oh, I didn't mention that CARMS basically is not kind of something like as floating in the air. It's an organization in Ottawa, non-for-profit, and they ensure they're kind of middlemen between the applicants and between the programs. When you apply to residency, you do not apply directly to the university. You have to apply to this middleman. It's kind of an online platform when you put all your information there and the programs is taking the information there. So that's what they do. And they also have a computerized system, matching system, when you match only to one program. You don't get several offers from the programs when you apply to residency. You get only one match if you match. Okay? Very competitive process. When you apply additionally to the general eligibility, provincial requirements, there are also some programs they want to test something. You apply to family medicine programs. They want to know what kind of resident in family medicine you will be. So they introduced 2 years ago additional test that's called Family Medicine Professional Choices, FMPRO-C. And some programs also want you to do CASPER test, like Family Medicine in Saskatchewan, some pediatrics programs, many radiology programs. So have this in mind. It's a long journey and very costly too. Money, lots of money, right? Because all these tests you have to pay for the application. So you better plan really, really, really well for that, really well for that. But you will see that the approach when you are thinking, oh, let me get a job first, establish here, start earning money, and then I will start thinking about my exams, and then you're like, no, that's not the right approach. You will see why. I'll show you when we'll go through the different pathways and options. So when we look at the timeline, usually it happens this in 2 iterations. It's kind of a 2 phases. Like CARM cycle covers 2 iterations, phases. September, the application opens. In December, interview invitations coming out. January, beginning February, interview invites, interview are happening. You rank the programs. In March, match day. Those who match start preparing for residency, doing the paperwork, pre-residency program, etc. All unfilled positions go to the second iteration. And you apply in the second iteration if you didn't match in the first iteration. Very short period you see in terms of the timing. Those who match go to pre-residency. All together, all of them start residency beginning of July, 1st, 2nd of July. Officially, it's 1st of July, but because it's a Canada, they start 2nd of July from day. So this is the timeline. So when you're applying in September 2024, the lucky ones will start residency in July 2025. Okay, so that's everything is happening during this time. What you need to know that when you apply to residency and when you match, there is a commitment to return of services. So you have to work in this service in the areas that are considered to be underserviced. The map shows the areas you are not eligible to work for 5 years in Ontario after finishing residency. So for 5 years, you finish residency in Ontario, any university. There are 7 of them. You cannot work in Ontario, Mississauga, Brampton, Vaughan, Markham, and Pickering. You can work in Oakville, Hamilton, London, Kingston, Niagara Falls, anywhere they are eligible for return of service. And you cannot work in Ottawa and surrounding areas. But once you finish, you can work anywhere in Ontario. If you match in another province, they have different approach. For example, Alberta and Quebec, they don't have return of service commitment. They don't. Some provinces have the same number of return of service years as their training, like family medicine 2 years, pediatrics 4 years, etc. And some provinces like Ontario, Newfoundland, 5 years you have to work. They need doctors, right? So this is what you need to know about return of service. But once you finish, it's not that government tells you, you have to go there, you have to go here. No, you choose where to work. You just know that you cannot work there and you go and work. What if you don't go? What if you decide, oh, I want to Toronto, I like Toronto. Government said, okay, fine, give us all the money that we paid while you were. It's also money. So it's the money of your salary, the money that's went into the salary of your preceptors, et cetera, et cetera. So it's just close to 150,000 to 100,000 for a short training. For a longer training, even more. You better not to do that, right? So, but when you're at the return of service, your compensation is any doctor in Canada. There is no cutoff in compensation when you're doing return of service. This is the question my clients are asking me. So what are my chances? What are my chances to match? And oftentimes I cannot say your chances are this or this percent, et cetera, because it's almost the same as you're a doctor, right? And someone come to you and said, doctor, what are my chances to recover like in a week? And the doctor said, well, I don't know. I need to test physical exam. I need to do patient history. I need to send you to the specialist, to the test, et cetera. And then when the doctor looked at that, then they said, on average, a patient like you, a doctor, you know how to talk, but you need more information, right? So therefore, my suggestion for you, look at the selection criteria that the program's applying when they select the candidates. And usually there are more applicants than the positions, okay? So they look at your MCC exams, QE1 and the NAC exam. They look at your recent clinical practice or training. It's very important. That's why I said the approach, oh, I do my job, then I do the exams, and maybe in 5 years I will start applying. No, my friends, 5 years gap in practice, detrimental. You are not seen as a safe doctor anymore. Therefore, if you decide to go this pathway, you have to do the exam as soon as possible, ideally with competitive scores. It's very important. Exposure to Canadian healthcare system, also very important. Any capacity, job, observership, research work, volunteering, continuing medical education courses online, anything. And demonstrated commitment to specialty. Every program wants to get people who really want to be in this particular specialty. And you know, like, you cannot build a strong portfolio for surgery and psychiatry at the same time. They're so different. They're so different, right? So therefore, technically, you are eligible to apply to all programs, but practically, you will be applying to the programs where your portfolio is the strongest, right? So, and personal and professional qualities like teamwork, collaboration, communication, empathy, compassion, leadership, initiative, like you name them. So this is what you need to have in mind when you start building a strong portfolio. Next pathway, I have to go through. My time is almost, I have 5 minutes left. I will be in a hurry. Sorry, guys. Practice ready assessment programs. And this is the pathway that is taking more and more and more attention and giving more opportunities to the IMGs. Practice ready assessment now in 9 provinces, including Ontario. For GPs, all 9, for specialists, Alberta, Manitoba, and Quebec. So I want you to understand what the programs usually look at when they select the candidates. Immigration status, postgraduate training, independent practice, rotations, MCC examinations, and language proficiency, and recency of practice. Again, recency of practice. So this is a general thing. And you see how many things depends on the province, depends on the province, depends on the province. So unfortunately in Canada, although it's introduced like pan-Canadian practice ready assessment, each province is doing their own thing. So therefore, since we're in Ontario, here is for Ontario. And I seriously encourage all of you who are general practitioners or family doctor to consider family medicine in Ontario, practice ready Ontario. Because recently the requirements are very much in favor of the IMGs. Postgraduate training, you can have 1 year, but broad-based internship. And during this broad-based internship, you can have 7 rotations. But if you are missing, and most of you have 4 rotations out of 7, most of you. Look at the rotations there. Internal medicine, general surgery, OB-GYN, pediatric psychiatry, emergency, family medicine. If you have a gap of 3 rotations, they will accept practice experience in lieu of missing rotation. Let's say you are from Egypt and you have 4 rotations: internal medicine, general surgery, pediatrics, and OB/GYN. You are missing family, you are missing psychiatry, you're missing emergency, right? If you work as a general practitioner and someone can write a letter of attestation, they will consider 1 year of practice as 4 weeks of rotation. It's a great opportunity for IMGs. In terms of independent practice, Ontario introduced the formula of 4. You have 2 years of postgraduate training, 2 years of independent practice, 1 year of a postgraduate training, 3 years of independent practice. Exams, QE1, clinical exam, language proficiency, and recency of practice, 960 hours. It's 6 months in the last 3 years. The best part is that they would accept also some virtual care, and also they work as a licensed clinical assistant in another province. Later, I will show you what provinces has this license. And if you are mobile between the provinces, you can move from Ontario to some other province. You can close this gap. You can close this gap. It's the 3rd cohort that Practice Ready Ontario is accepting now, and I see how licensed clinical assistants are being selected for the program. Great opportunity, guys, for those who are general practitioners. So the process goes usually eligibility checking, then you have to do therapeutic decision-making exam. That's knowledge of Canadian drugs and medications. You have interview, registration with CPSO. 12 weeks they do assessment. That means that for 3 months you're working and your assessor is watching you every day, how you treat patients. That's the assessment. They don't train you, they assess you. That's what it's called, practice ready assessment. You pass the assessment, off you go. You practice with the restricted license for 3 years. You do the exam, certification exam, and you're fully licensed physician. Practice eligibility route is for, yeah, I need to see that, that's why. Practice eligibility route is for specialists. Also excellent options for those who are not family doctors but specialists. All regulators are looking at your postgraduate training. So usually you're not from approved jurisdiction, but they will allow you to do the exam, Royal College exam. They need to assess your training. And when it comes to training, it means your residency training in your specialty, residency training. Let's say you are an obstetrician gynecologist and you have 5 years of training in your home country. That means you may be eligible for practice eligibility route. So how does the process happen? You apply, they review your training, you have to submit, of course, documents, and if they accept it, they give you the letter of eligibility. Within 5 years, you can take the Royal College exam, applied part and written part. After that, you need to practice in Canada for 2 years. Here is the question. Can I practice in Ontario? Unfortunately, no at this time. Anywhere in Canada, yes. Nova Scotia has this license. British Columbia has this license. Saskatchewan has this license. My friends, by the time some of you decide to go practice eligibility route, I hope that Ontario will have it because it's a pan-Canadian pathway. The provinces are slowly going on board. So after 2 years of practice in Canada with a restricted special license, you are assessed. Assessed, easy. Someone goes to you for a week, sits, watches you, and then you get full certification. So that's practice eligibility route. And those of you specialists who have training that is somewhat similar in Canada, I seriously recommend to consider that. And Manitoba licensure program. This is for rural family doctors. Do you have a broad-based internship? Eligibility criteria. Did you practice 1 year independently? Did you pass the NAC exam, language proficiency, and you did it all without having a gap in practice, not more than 5 years, you may be eligible. Although recently they give preference to those who are already in Manitoba and who work as licensed clinical assistants. So it's a 1 year, they train you for 1 year, then 4 years you work in rural Manitoba. Once a year, the application is open. The application is free, but I said, you want to pursue, consider this path, include it in your action plan. It's very feasible. Only yesterday, I got a mail from my client who said, Irina, I've been invited for the interview, and I want to thank you for guiding me last year. Because of your advice, I moved to Manitoba, I got licensed, I work as a clinical assistant, now I'm invited, I'm very hopeful for my future. And I'm hopeful for her, because for her, it was the only way. Her exam scores were not competitive enough for applying to CARMS. She was not eligible for practice ready assessment, but she was invited for MLP IMG. So hopefully she gets in 1 year of training, and then she is a doctor. After 4 years of return of service, she can go and work anywhere in Canada. My last slides. Academic license. What is academic license in Ontario? It's when you get the academic position in the capacity of assistant professor, associate professor, or full professor with a medical school. And it's not easy to get this job, and usually they prefer someone who has very solid research background. And maybe the name is a little bit more prominent than just regular IMG. It's a rare case, but it's not impossible. And I just want you to know that exists. And when you keep this license for 5 years, and when you keep the position for 5 years, then after 5 years, you convert this license into restricted independent. You work anywhere, not necessarily academic setting. You apply directly to the post on the university website. This is the opportunity for the physicians with a very strong academic and research background, usually specialists, not family doctor. And the last basically part about the license as a physician is subspecialist affiliate status. The CPSO recently introduced that. And this basically the license for those who are in clinical fellowship as subspecialists, neonatologist, forensic psychiatrist, let's say interventional radiologist, etc. So gastroenterologist. Royal College may allow to do subspecialty exam, and with a program that's called SEAP, Subspecialty Examination Affiliate Program. After passing this exam, when your fellowship ends, and of course you cleared the QE1 and get LMCC, you can work as a subspecialist anywhere in Ontario with this license. But this pathway is mostly for clinical fellows. Although the Royal College is saying, look here, oops, can I do this? Okay, it's lost again. You see the very bottom, SEAP PER route. For practicing doctors, subspecialists in Canada who are not Royal College certified. And you may say, but how can you work as a subspecialist if there is no license? Well, very rare case, some provinces, like Nova Scotia, Atlantic provinces, New Brunswick, Prince Edward Island, they may hire an IMG subspecialist if there is a high need. It's their own provincial prerogative. You work for 2 years, you apply to Royal College, pass this subspecialty exam, you have LMCC, you can come back to Ontario. I know it sounds very kind of a far away from you now, but it's part of the information that you may be it may be useful for yourself or someone you know. And licensing options that are not physician. And these are licensed as physician extenders. Clinical assistant license in Nova Scotia, Manitoba, Newfoundland and Labrador, New Brunswick. Associate physician license in Alberta, British Columbia, Prince Edward Island. For Ontario, not such license, but physician's assistants will be regulated next year. In order to be a physician assistant, you need to go to a 2-year program, University of Toronto, McMaster University. There are also programs in Manitoba, Alberta, and Nova Scotia. And also there is a clerkship program in Quebec and Nova Scotia when IMGs get accepted to medical school, Canadian medical school from year 3, clerkship year. Very limited number of positions, 2-3 positions a year, but this option exists and some IMGs are using it. What's new in Ontario? Unfortunately, my friends, I don't have great news for you because no clinical assistant license, but Practice Ready Ontario is very promising with the new eligibility criteria. The pilot phase that started 2023 will finish 25, will put almost 80 doctors in our system. That's substantial in my opinion. 80 IMGs will become family doctors. Also, the programs increase the number of positions. Look here, in 2024, residency programs had 211 positions for IMGs. In 25, 283 positions. For me, it's a substantial increase, 34%. Also, new medical school opened, Toronto Metropolitan University, and which means that new postgraduate training sites, they are mostly in Brampton. And CPSO will start regulating physician assistants in April 2025. I'm not going to spend too much time here because my time is up, but this is the services that we provide. Services that we provide. And thank you. Contact information.
Thank you, Ms. Edilova. That was amazing. How many of you here today got information that you never had previously? How many of you by a show of hands? Pretty much even me. I mean, I'm learning every day. And this was a lot of complex information presented in the most uncomplicated manner in a short period of time. So thank you so very much.
My session is usually 2 hours, so it was really a challenge for me to put it into 35 minutes. So thank you for listening.
This is Saida, who would like to present to you this little token.
Thank you. Thank you so much, Arina, coming today. And as usual, giving us a wealth of information that we all need. Thank you so much. Well, I want to say that although in my capacity of IHP advisor, I don't give you one-on-one time because I'm just the only one at this time with so many clients. But when you email me, I always respond to you in your particular situation related. Look at your situation, look at your CV, and advise on your pathways. Help you to create the action plan that includes timeline and everything, okay? So do not hesitate if one of your goals is licensing. I can attest to that. Thank you.
I would now like to discuss the IEHP Partner Spotlight, which involves recognizing the organizations that are collaborating with Pegasus to support IEHPs. And these would include today, Achieve, who provides financial assistance to newcomer ITPs in Ontario through loans of up to $30,000 and provides employment support through their career assessment program and their EPIC program. Thank you for being here today. Openness Educational Foundation, They provide financial assistance to IEHPs towards the licensure process. Thank you again for being here today. The Peel Career Assessment Services that help with workforce integration support, employment assistance, workforce integration program, which includes a stipend for participants. And we will now break for a 10-minute break. Please come back at 12:10, where we will have our next speaker, our next guest speaker, who will discuss alternative career pathways in healthcare for IEHPs, Dr. Mikhail Chaki. Thank you. We'll join again at 12:10 sharp. Thank you. Hello. I'd like to welcome you back to the floor, where we'll have our next guest speaker present to us alternative career pathways in healthcare for IEHPs. Dr. Mihai Chaki, a medical affairs professional, has practiced emergency medicine in a busy academic hospital in Romania. He has held executive positions in clinical research, sales, marketing, pharma, distribution, and occupational medicine, both in Europe and in North America. Dr. Mihai has also worked in recruitment, career counseling, training and development, commercial and scientific functions, mostly in the pain and oncology hematology space. He has co-founded and co-owned several pharmaceutical distribution centers in Romania, a pharmacy, a dental store, and co-founded a Romanian pharmacy and medical software company, later acquired by the world leader in life sciences, Cegedim. For the past 14 years, he has helped hundreds of internationally trained health professionals navigate the complex healthcare landscape for newcomers to Canada, focused on the Canadian alternative pathway options. Today, he is a medical affairs professional and is located in Ontario, Canada. Welcome.
Okay, so as Mihai takes the stage, I'm going to invite all our participants to come back on the inside. We do have some interactive activities as well that we would like you to participate in. All right, so you will have some more time to network again after Mihai's presentation, so please do just rejoin us.
Thank you. Thanks for giving us the opportunity to help you. Thanks for the organizers for putting this together. It's not an easy task to be here on Saturday lunchtime, so I have to make this relevant enough to worth your time, because either you drove here or you're online, and in the weekend, there's a lot of things you can do, and this has to make sense to you. So thanks for that. There's a quote from Blaise Pascal that I know, which is, I would have written a shorter letter if I would have had more time. And that's what we're going to try to do now, to jam a lot of information in 35 minutes. It's not an easy task. We, together with my team, we run programs that are spread out in 4 and 6 weeks. So to put all of that in 30 minutes means that we're going to talk about the what to do rather than how to do it. It's difficult to put all of that in such a short place. I need some help here. Okay, so a little bit about myself. I'm an international medical graduate. I'm an emerge doc by trade, practiced in Europe. So there's a time when I was sitting, as you're sitting there, and thinking, what are my options? What should I do? So what I'm telling you comes not from a place of theory, but also from the place of helping more than 1,000 immigrant doctors, pharmacists, dentists, allied health. We had lactation specialists, dietitians, nurses, anybody, physiotherapists that come to Canada and they need a place to start. Like, what should I do first? Let's see if this works now. I wear multiple hats, but the reason why I'm here is because I'm passionate about helping everybody who comes to Canada find their path. And I can tell you for sure, this country is built on immigrants, and finding a job in Canada is a matter of when, not a matter of if. So don't get stressed about the fact that you're not going to find a job. Everybody finds a job. It's just a matter of how do you do it to your values in a timely manner. There we go. Okay. So a lot of things we're going to cover today. Okay. So feel free to interrupt me if you have questions. I'm going to go pretty fast because time is of essence, but also this is going to be available online, so you can go back and look at it. But at the end, we're going to leave you with the context so you can contact us and get more information. I'm involved in, I'm currently in medical affairs. So I work in the scientific group with a pharmaceutical company. I also co-own and manage the newcomer support company. I'm also chairing the CCP, which has over 10,000 pharmaceutical reps that went through certification and 3 different courses. I also work with other programs. Not going to spend too much time there. Let's go with following on what Irina said earlier. When you are new to Canada, there's basically 4 options that you can take. One is, am I going to get my license? 2, I'm definitely want to stay in healthcare place. I know that space. I want to use as many skills as I have. 3, I don't know exactly what I'm going to do. And the 4th is, I need a job right away. These are the 4 options, and please correct me if there's anything else there. But basically, we're going to take them one by one and see how that fits. Here's an excerpt from an article written by Cameron Moser. Cameron is the Senior Director of Services, Newcomer Services and Program Development with Access Employment. And he manages several programs together with the team. The one for alternative paths is called Healthcare Connections. And here's what he posted. He said, there's more than 250,000 of internationally educated professionals in Canada. But most of them will stay in healthcare, but the majority of them will not get licensed. And you look at doctors, dentists, pharmacists. So then what do? What's the majority? What's the most likely scenario for a person that comes to Canada, have the background, have the license, but they are not licensed to practice here? And that's what's going to be discussed next. Just to put it in perspective, 260,000 is the entire population of the capital of Saskatchewan, or it could replace the entire workforce of Quebec City. It's a lot. So now, following on what Irina mentioned earlier, how many of them secure residency? 1,600 were participating, accepted in the CARMS program. And out of those, 671, which is a small fraction of the, I don't know the latest numbers, but I know it's more than 13,000 international medical graduates in Ontario alone. So not very encouraging. Furthermore, and Irina mentioned this as well, the more you go down in time, the less chances you have to secure residency. So now what do you do if you miss that first 2 or 3 years after graduating? Here's what together with our company did for the past 12 years. We ran a polling on what do you think are your top career choices? You're a newcomer to Canada, and now I'm also addressing the online audience. We're going to run a polling if we can technically get that, which is, if these are the groups of jobs that we can get in Canada as a newcomer, which one would you check mark? what are your top ones? And the way we came up with these, you will see 10 on the left hand, and then there's under other, it's everything else. So for those online that take this, make sure that you maximize the screen so you can see all 10 options. And then you can check mark 1, 2, or 3 of them. It doesn't matter, but we'd like to get an idea to know how to focus on this presentation. So that means that, okay, there's an option called healthcare licensing and others, but there's 9 others. So then the question is, if that's one of the 10, are you interested in others? And if you are, which ones appeal to you the most? So we'd like you to use that. And maybe, I don't see the numbers. Give me 1 second. Okay, we have 22. Maybe we'll wait until we have like 30 responses and then we'll stop it. So one of the things that we do is to introduce to you all the options you can have. Because one of the things you need to learn is not only what to focus on, but what not to focus on. Because in this information overload times, if you ask any question on Google, you get 10 million answers, but you don't care about 9 million and 900,000. You only care about the top 5. So the question is, how is that relevant to you? Where do you start and where do you not start? What you put aside. Don't waste your time on things that are not relevant. So maybe we can stop the polling. Thank you. Okay. So I want you to stop and yeah. So now what I'd like you to do is go back to the presentation. Just we're going to save this for later, okay? We're going to save this for later, but go back to presentation and I'm going to show you what our 12 years experience shows like for the population that encompasses internationally graduated, educated. Yes, hold on a sec. I don't seem to have progress here. Oh, here we go. Okay. So since 2013, together with my company, we ran this polling, which you just did. And here's the results. If you look at the total number of votes that we got, the most common path that newcomers pick is clinical research. And then there's health promotion and education and medical administration and so on. But what we also did is followed up on this with, okay, this is what you want, but what do you actually get? And we can tell you that the outcome of what you get is slightly different because there's not enough clinical research jobs. It's easy when you come to Canada and you say, clinical research, everybody searches for the same thing. What does it mean? High competition and probably chances to be disappointed. Some of you will get it, but some of you will not. So then the question is, isn't it better to go in an area that's more relevant to you when there's less competition? There's a hidden market in which nobody competes against you. If you find out about it and others don't know, you're the only applicant, you have to really make a big mistake to not get hired, right? So all of those matter. So this is what we had so far until now. So then, what are the alternative paths? The alternative paths mean that you lost your license, privileges here, you still want to stay in healthcare place, so what do you have to do? Like, what would be good? So there's a lot of elements here, and I'll just put them on one page because it makes it simple to list. One is healthcare in Canada is well-funded, serious, increasingly growing, has a lot of funding. Canada's pioneering research and development. So it's a good space to be in. Second is you need to be driving in the driver's seat. So whatever you do, it's in your hands. So be active and don't let others drive your success. It has to come from you. But in order to have to come from you, you have to know what your options are. Third one is, when I came to Canada, besides the fact that I lost my license privileges, I lost my network. I was invisible. I didn't exist. People don't know me at all. This society functions well without me. You know, how would I make value? How would I bring value to this society? That is building a Canadian brand. And there's a lot of things you can do, because a brand is a promise of value, is something that when you say a name, if I say Bill Gates, you understand what I say. If I say Mercedes, you probably don't own a Mercedes, or maybe you do, but it doesn't matter. You know what that means. Well, your name has to mean something, and it did back home. So how do you build that brand? Because if you have a brand, the interview is a different conversation, right? So that's learning to differentiate yourself. And if you did not, I urge everybody to be able to answer right now on the spot. If I ask anybody, why would you hire me? You have to be able to address that in a way that's genuine and relevant. So now, here's the main two objections that I saw from newcomers are technically not 100% true objections. And they are, you don't have Canadian experience or you're overqualified. But if you get those questions during an interview, it's misleading. Why? You are in the interview. They knew you are overqualified. They knew that you don't have Canadian experience. So then why are you there? And what's behind those is actually what matters. How do you address what's behind the question, not the literal question, because there's something that triggered it up, okay? So they still give you a chance, but they're waiting for you to give them the right answer. So that's another thing you can address. And the last one, I mentioned that you're gonna get a job no matter what, unless you don't want to. Okay, so now we got to transferable and non-transferable skills. Okay. You lost a non-transferable skill, which is the right to practice as a dentist, pharmacist, doctor, it doesn't matter. But what about the transferable skills? There's a lot of skills that you're bringing to the table. And here's the catch. Back home, if I would apply for a job, I would just bring my diploma and they would say, okay, you're hired. But here you don't. You have to rely on the transferable skills. And it's an awkward position because you have to sell yourself. You have to say how amazing you are, but don't think they know how amazing you are. And you are amazing. Like you are highly achiever enough that you succeeded when a lot of other people failed. You have to translate that into, give me a chance and I'll demonstrate how good I am. Taking care of patients is a transferable skill. Being passionate about learning like a nerd, it's a transferable skill. Being nice to people, saving a life, that's something that you can transfer. Caring about others is something you can, being a nice person, honesty, all of those are transferable. So don't stick with the fact that you lost a license, where there's a lot of things you can offer. But the trick with that is you have to learn how to put yourself in value. And that's not easy because that's something new. Okay, so newcomer strategies, where would you start? Remember that I had a polling with 15 options? What we did is we clustered, we have over 1,000 job titles in our database, and we clustered them in job families, and we said, okay, which one are you interested in? 1, 2, 5, or 10 of them. If you're interested in those, what can you do to match those? So now your application goes in that space. So the starting point would be, oh, this is not go here again. The starting point would be going to pick the space that you're interested in. The second point would be networking, which is what you're doing right now. And networking is getting to know people and build trust. Because I guarantee to you, if there's a job posting, they will never hire the person that has the most qualifications. They will hire the person they trust the most. And if they don't trust, I don't care if you have 10 PhDs, if you don't project trust, you're not going to get that job. On the other hand, if you're nice and trustful and friendly and connect with people and empathetic, you will get a job, although somebody else might be more qualified. So what we're saying is networking is that capacity to bring connection and building a brand. And the fact that you're here and the fact that you're not, spending weekend with somebody else means that you're interested in building that brand. So that's something that you have to focus on. That's a newcomer strategy. Now, how do you do networking? Job fairs, in person, online, LinkedIn, you name it. And we're going to talk about LinkedIn later. But this is an article I wrote with the Medical Society Liaison Journal, which is, they have, I think, maybe 30 to 40,000 members. But the point of this is Dr. Gradovetter, which is one of the most cited sociologists in the world, said the following: you will maximize your job employment not by talking to friends, but by talking to weaklings, which are weak ties. It's second layer friends, because chances are that you and your family and your friends have the same connections, and you find the jobs that they know and the same friends that they have. But those second and third tier connections have exposure that you don't have. I looked up my LinkedIn profile about a month ago. At the third layer connection, I'm connected with 1 billion people. 1 billion. That's, maybe half of the adults of the world. 3-layer connections. So what we're saying is tapping into other connections means networking. You never know. People reach out to you, or you will reach out to people you don't know and create opportunities for job employment. And this is something that fails me again. Here we go. Okay, so we talked about networking. We talked about LinkedIn briefly. Just to put it in perspective, LinkedIn Canada has more members than the entire workforce of Canada. Every minute, there's 100 plus postings of job opportunities in North America. 24/7 job fair for free? Like, why would you not use it? But then the trick is not to have a profile. The trick is, how do you make it work to your advantage? What do you have to do so when somebody reads that, gets an opportunity to invite you for an interview? Or the other thing is that 65% of executive recruiters say that the applicants misrepresent themselves in the resume. So they trust public profiles rather than private profiles, because on a resume, you can say whatever you want. But when you have 10,000 connections, you can't actually state something that's not true. So that's something also that we are looking at. And the last point that I have is getting help. I know that, we're high achievers, so we have a strong personality. And with that, it's not easy to go and ask for help. But there's so many initiatives by the government and so many initiatives like this one today that would say, talk to people who know the shortcuts. Don't waste your time. If somebody knows how to help you, why would you not consider them a friend? Go and ask them. It's okay to have coaches, mentors, to ask for questions. And if from today you get one tip, one might make a difference in your interview. And if you get 2 or 3, bonus. So don't shy away from doing that. That would be my takeaway. Where can you get help? Our company is on the top just because I'm biased, but it doesn't mean that this is the order. But our company works with all these agencies, and everybody, all of them can help you. There's programs that are specifically for newcomers that operate and want to stay in healthcare, and that's exactly what you need. So these people are professionals that are specialized in this. And if you work in an area for 10, 20 years, you definitely know something that a newcomer doesn't. So don't shy away from doing that. This is my team, internationally educated graduates, and there's more of us. Some of the names there would probably ring a bell to those of you that are in this space. So feel free to reach out. This would be the time where you can ask questions if you want. Thank you. I was so clear that nobody has any questions. Yes.
Thank you for your presentation. It was really insightful. I'm Harpreet Kaur. I'm an international educated and experienced dietitian
having a 17 years of experience with the healthcare in hospital and clinical settings.
Yeah.
I'm right now pursuing ISAGE program for geriatrics, which is a bridge program through George Brown College. And I'm here to look into different opportunities in the healthcare.
Right.
My question for you is, what is the best possible pathway for IHP like me, who is a dietitian and pursuing the geriatrics into a field right now?
Right. Thank you for the question. I will take your question and answer it, but I would broaden it up. You know, I would take from your question that I have a license, I'm taking a program, I'm looking for something, right? So what would it be that path? So here's how I see this. When you apply for a job, you're technically, consciously or subconsciously looking for the best match to your skills. Like, this is what I want to know. This is what I know how to do. This is what they want. Is this a good match, right? Now, in order to that, you have to have clarity on what your skills and passions are, okay? That's not an easy task, because for most of them, you know them through the license that you have, but you're much more than your license, right? So you can offer, for the thousands of people that we help, there are moments when somebody said, I was always passionate about mental health. I don't have a background in that, but that's my passion. That's something that you're passionate about. That could be a new avenue. So I'm not saying it's a reset moment, but you could explore other areas. So now again, you have skills, you have a job match, and you want to address that. So one thing is to identify exactly what you're interested in, which is not an easy task. I'm sure that, and it's not you, I'm not singling you out. If we talk to anybody here, you would find out that there's areas that you didn't explore enough. I have a friend who ended up working in the veterinary service, you know, having a dog, you know, you somehow sympathize with having a pet, but it's something that you don't think right away. And she's so happy when I talk to her. It's like, I didn't even know this exists. I'm happy where I am. So one thing would be know yourself. The second thing would be broaden your search. But the third thing you mentioned is that you're taking a bridging program. When you're picking a program, also look in what are the post-graduation opportunities. Do they have co-op? Do they have, what are the most likely jobs that they get in those? So in your particular program, if you talk to the program director or coordinator, I'm sure that they will give you some hints, where would they graduates go to? So all of those matters. I would be happy, I would be thrilled to give you an example of a job and you take it, but it's a bit more difficult, a bit more broader than that. So I hope that just painting the big picture will be sufficient enough for an answer. Thank you.
Thank you so much. Just that one more question is what is arising right now is there, how can, your organization help IHP like me?
Yeah, sure. So I think it might be here. I'm gonna give you the contacts here. So get in contact with us. We help, we're open to help as much as we can, right? So the easiest way to contact me is LinkedIn. I'm pretty active there, but the other ones stay as well. So feel free to contact us. We'll help you. And if we don't have the resources, we'll guide you to who has the resources. We're pretty well connected that way. Thank you. Yes.
Thank you for your question. I will pass the mic on to you. First, we have a question from Zoom, and that is, what are some of the strategies for making connections on LinkedIn?
Okay, so thank you. Thank you for the question. It is a crucial question. We have a 2-hour LinkedIn program. It's very difficult for me to give you a very brief strategy, but there's 2 key points that I want to make on LinkedIn. So first of all, it's a more powerful tool than we would think. We on a regular basis have newcomers to Canada that said, in my country, nobody uses LinkedIn, and I'm a doctor. Like, why would I don't need the LinkedIn. But then once they get in, I have so many examples. A lot of people call me after they get their jobs and say, actually, somebody called me through LinkedIn. Like they approach me. Like, it puts you in a position of power. But going back to the LinkedIn strategies. So there's two things. One of them your LinkedIn profile should help you and not put you down, which means our matrix has like 26 parameters of LinkedIn, and we compare to the average. And if your photo is worse than the average, if your profile description is worse than the average, if your skill list doesn't match what you do, you're not doing yourself a favor. LinkedIn is so well designed that it works for you if you know how to use it. So one strategy is using LinkedIn profile properly by building a good profile. So that's the first tip of the two. The second tip of the two is you have to be active on LinkedIn. Just creating a profile is not enough. So I have this, and I'm not saying it happens a lot, but it happened, that I connected with somebody, international educated graduate, no connection, and 4 years later sends me a message like, hey, Mia, I see that you know that person. Can you get a job for me? It's like, you need to earn that. You have to do something about it. I can't be giving out, my recommendation for a person I didn't ever spoke to or spoke to 5 years ago for one message. So what I'm saying is, when you're active on LinkedIn, build the network that you're interested in. If you want pharmacy, then go join the pharmacy groups. If you see an influencer there, then comment, have an opinion, connect with them, get a warm introduction, not a cold, I want to connect. Like, look, I heard you speak at the conference. Can we connect? Or, you're working for a company that I always looked up, whatever, make it warm. So there's so many strategies for LinkedIn. It's difficult to put everything in one sentence, but I can tell you it works and it helps a lot. I hope I addressed that.
Okay. Thank you so much for all the insightful information. So my question is regarding the myths you spoke about when it comes to overqualification and no Canadian experience.
Yeah.
I understand where you put it in an interview. It's easy to express yourself, tell people what you can do, these are the skills you have. But the problem is, as an international professional, you are coming in, you want to go into a different profession.
Correct.
How do we pass the ATS scanning process if we are open? Because what I realize is that most time as international professionals, we have to water down our qualifications or skills to get the attention, because you might not even get to the interview stage with when you put your pharmacy or medical title and everything. So my question here now is, how do we present our experience when we are applying for jobs in such a way that we will get to the interview phase?
Agree.
And then my second question is regarding the statistic you did. I'm a pharmacist, and I saw from your statistic that research was topmost, and it's obvious that so many people are going there, the competition is higher. So, and the first inclination as a pharmacist when you come here is to go for such jobs because it's very close to what we do to an extent. So what recommendations do you have in terms of diversifying for a pharmacist while we are waiting our licensing? Thank you so much.
Yeah, thank you. Excellent questions. Thank you. Both of them extremely relevant, and you're not alone. This is not something that you face. Everything you said applies to probably everybody here. And the first one is, how do I make my resume relevant? Because the scope of the resume is not to get a job. The scope of the resume is to get invited for the interview. That's exactly it. But that means that when you write the resume, you have to keep in mind that the resume is not a bragging document. You don't have to say how amazing you are. It's slightly different, and it's how well suited you are for that application. So it's a matching resume, right? So that resume has to say, I am the perfect candidate for this job. And I'm gonna give you, and I'm tying into the being overqualified part. I've seen this not once. The resume starts with, I have 25 years experience in running a radiology department in an academic hospital. That's not gonna help you get a particular job. There are jobs in which that's important, but it's not the most supportive format. Now you can say that I've been helping thousands of patients, You can say that I inspire confidence and trust. You can say that I'm passionate about helping others. You know, I get rewarded when people get better and they thank me and they come, you know, to me for advice. It's slightly different, but you feel the nuance. It's slightly different. Now, so that's about the resume. There's about being overqualified. We have like a 2-hour session just on that, because you're right. If this would be easy, everybody would be able to address it, but it's not. To be done, sure. Has 2 components: how to address it before the interview and before the application, and how to address it during the interview and the application. All of them, we can connect offline if you want, but there's a lot to it. So I'm not gonna minimize that. The second part that you answered, the second question you asked is, where would an internationally educated healthcare professional start? And I think in a non-regulated environment, which is when you don't have a license, you face high competition. In high competition, you have to stand out. When you stand out, you have to offer something that others don't offer. So in translation, that means you have to do something that others don't do, okay? So now I'm gonna get close to your question. You get yourself up in the morning, print out 5 resumes, and you walk in a pharmacy. And you go to the pharmacy and say, look, I know what I'm doing. I've done this. I watch this pharmacy. It's always crowded. There's always a lot of people. Give me a chance. Give me 2 weeks. I'm going to be here every day. And I don't want you to pay me anything. 2 weeks later, we talk. I'm passionate about this. I can bring value to your practice. Let me start here. A lot of them would say, that's interesting. And some will give you a chance. Now, volunteering goes back to what I said earlier, building trust and building network. Because when you hire somebody you know, then you don't take a risk. The biggest fear of any hiring agent is to hire the wrong person. So if they trust you, they know you. So now going back to the pharmacy exercise, if you go to the pharmacist, I'll give you a side note. My daughter was 18. She printed out her resume. She walked in the first pharmacy and she said, I'm here, I'm interested in this, let me work here. And the pharmacist said, you know what? I received 50 resumes, nobody came in person. Just because you took this was COVID times, right? So just because you took the time to come here, I'll give you a chance. And then after she finished her 3 months of summer job, they wanted her back right away because she made an impression. And if you are a healthcare professional, you make an impression. They just need you to give you the chance, which you don't have. So your question is, how do I get a chance technically? And the answer is, you need to do something that others don't do. You have to make that value proposition and tell them, this is why you should hire me.
What I'm understanding from that is create your own opportunity sometimes, and that might take you where you need to be. We do have another question,
Sure.
and thank you for the brilliant suggestions and advice.
Sure.
Hello, thank you for motivating us today. I'm not sure whether this question is relevant or not. I'm basically a dentist by profession, and I have recently come from UK, and there I luckily, without my licensing pathway, I got a job as a temporary registration, which the GDC provides. So I was wondering if there's any temporary registration pathways here in Canada which I can pursue. Like, is there something while I'm pursuing my license, is there something Canada provides? Because that is not like a very common thing in UK as well. Like, people don't know about it. So it's something I got to know by friends. But is there something here like that?
Okay, so
Especially if you have like experience in a specialty, like I have experience in max fax surgery. So
Yeah.
if you have postgraduate experience,
yeah.
do you have
Okay,
any?
so to my knowledge, so there's 2 layers. One is the regulated job, which you technically don't have yet, and the non-regulated. All of the non-regulated positions you can take, like being, you know, an office admin, being a dental assistant, like all of those. Like the regulated jobs, like a dental technician and hygienist, those need regulation. Not with the dentist, but with the pharmacist, there is a case, which is you can work as a pharmacy technician if you pass your first exam in licensing, but you're not licensed yet, that they recognize it, the college would recognize it. To my knowledge, not with dentists. So the only thing you can do is, and dentistry has, it's like applying in a dental office has the following specifics, not as much in medical office and dentists and pharmacists, which is a lot of the jobs in dental offices are hidden market. So I have a dental admin, the dental admin leaves, and suddenly it's Friday night, I have patients tomorrow, I have nobody to help me out. What does it mean? The first person that applies for that job, it's going to get the job if they're available in the afternoons, in the evenings, you know, if they are okay they're in a, you know, pretty available location. So that's something specific. Your immediate availability and access to the hidden market means that you find out about jobs when others don't. Then the question is, how do you find out about those jobs, right? So that's where networking and getting into contact with dentists, like even calling or walking into a dentistry office and say, look, this is who I am. This is what I'm interested in. Give me a chance. They might not. But one of the tricks, and I suggest it to everybody, don't take a no as a black or white no. Follow up on that. And this was something that, you know, previous presenter said as well. Okay, you don't have it. If you have it in the future, would you reach out? When can I call back? Is there anybody else that you would suggest? Looking at my resume, what other jobs do you think I can match? Is there any way we can keep in contact? All of those are on the table. So to your point, you never know what opportunity comes up, but you're limited to the non-regulated space for now. Okay.
We do have another question online, if I
Sure.
may. Thank you. So this is a nurse / midwife who has over 5 years of work experience and is working towards licensure. So there are twofold questions. One is, what kind of advice would you offer regarding a profession or a career or an opportunity that the person can avail of now while they're working towards licensure? And the second question is, what kind of information can you provide about a licensure pathway for nurses in Ontario specifically? Thank you.
Sure. Okay. So the first question would be, I will translate it in the following. You have an ideal job, which is your dream job. It gives you everything that you want. But then you have an initial job, like the short-term solution. Those two are not necessarily the same. So then the suggestion that I have is, if you want to start somewhere, when you pick your first job, you can get an entry position in a company or an environment that promises. So in other words, if you're going to work in a large pharmaceutical company and you want to become director of pharmacovigilance, for example, it's okay to start as a medical information specialist, which is a more of, or associate, which is a more of an entry position than a senior one, but you know that you can grow. And this translates into any senior healthcare position, as long as you have an environment. I just spoke to another international graduate 2 weeks ago, and he was working in a hospital, and he started in one position, and then 6 months later, he moved to a second position. And now our conversation was, because we also do career path coaching, not only first jobs, like, what are the next best steps to do to grow? So my suggestion would be, start somewhere where you have opportunity to grow, and then you grow in that same space where you build the trust, where people know you. So that's the first one. When it comes to the second one, to not take the time of everybody else, tell the person to connect with me, and then we'll take it offline.
I think that's great advice. Thank you so very much for your time today and your valuable opportunities to discuss all of these wonderful questions, and hopefully they can take it from there.
Thank you. The last thing is, for the past 2 years, I'm working on a project, a career fit, which is going to be a slider of all that you want in terms of, I want a job right away. This is the minimum salary. This is the distance. I have a driver's license. These are the spaces that I'm interested in. It's going to come out probably in 2 months. And then you're going to be Once you do that, it's going to filter out all the job titles that exist in our database, probably about 1,000. And it's going to tell you job posting, requirements, applications, and all of those. So, but that's to come. Thank you.
Thank you very much, Mihai. I really appreciate it from the entire team at Pegasus Institute.
There you go.
Very interesting presentation, very interactive.
Okay.
Much appreciate that.
So the learning is we need to water the plant to grow, right?
Exactly,
Okay,
exactly.
here we go. Thank you.
Stay green.
And now I think I'm going to invite Dwight and Saida with, we have a break for 10 minutes. Please join us in 10 minutes. Thank you. So that would be 1:10. Thanks. I request you to kindly take your seats. Thank you. I would like to extend a special thanks to Mr. Mohammed Nashat from Baytech, who has been instrumental in assisting with web development, the pharmacy content writing, and infrastructure of the hybrid section of the Pegasus meeting today, that all of you who could not attend have now the ability to attend. Thank you.
Thank you very
so
much, Dr. D'Souza, for the introduction. I really appreciate that. And it's been an amazing journey supporting Pegasus with the IEHP journey.
Awesome.
And thank you very much.
Thank you.
Appreciate it.
And last but not least, we have Mr. Dwight Baker and Miss Saida Azam, who will be speaking to us about access to IRCC-funded resources and programs for IEHPs across Canada. Please welcome them. They are the glue who have held this fantastic program together. And thank you very much personally for the amazing work that you continue to do.
All right. Thank you so much, Janet, for that lovely introduction. Okay, good afternoon, everyone. All right, so we are about winding down with the content and delivery for today. And of course, you should be able to see we have some information up there on screen for you. You can scan the QR code to go to the agenda if you wish to. Now, this screen is for our Francophone speaking participants. It's just an apology. All right, I won't try to say that in French. All right, next. All right, so we are the Pegasus team, and you will hear us from time to time use the abbreviations IEHPs, meaning Internationally Educated Healthcare Professionals, or ITPs, that is Internationally Trained Professionals. So whenever you hear we use those are the two specific groups that we're referring to. IEHP is the subsector or subgroup under ITP. So ITP will cover all of the internationally trained professionals. So be it healthcare workers or the civil engineering or construction workers or legal professionals, finance and business sector, okay? But when we say IEHP, we're just speaking to or medical graduates or pharmacists, dentists, and so on. Okay, now let's next. At Pegasus Institute, we support internationally educated healthcare professionals, including refugee and asylum-seeking healthcare professionals in achieving licensure and, of course, integrating into the Canadian workforce. Now, our IHBs, especially the refugees in our program, they come to us with a myriad of experiences, and some of them are not experiences that persons like to talk about. They're experiences that persons sometimes don't like to think about, and they're also, these experiences also comes with triggers that are also very unpleasant for these individuals. And with all of these challenges, you have to deal with barriers to integration. And at Pegasus, we're here to basically help to remove some of those barriers. This event that we have today is one of those events that we hope, of course, you will find meaningful with the various experts that we had presenting earlier on those pathways to licensure. And the focus of this presentation, of course, we're going to be looking at some of those sector-specific resources, and we do have some of those sector partners here with us today, or community-based organizations that has a variety of resources that you can access as IEHPs to make the process a bit smoother for you. We have oneness here. There was Talent Beyond Boundaries. I think they were sitting there, didn't really occupy their table. They left a little bit early. We also have Achieve, and we also have recruiting partner there, the Correctional Services of Canada, and our host, community-based organization, PCAS. Thank you so much. As we go through, we're going to be talking about those organizations. Look at pathway guidance, those that deals with skills development, career connections, and access to those resources. Now, being mindful of the aforementioned challenges, we developed, of course, culturally sensitive and individualized program, and those programs that we have are group mentoring sessions. And within those group mentoring sessions, they take the format of webinars or seminars, social events, and job fair, which is, this one is our first job fair event. It was supposed to be, of course, hybrid seminar plus job fair, which is not usually something that you will see happening commonly. And of course, hybrid again in the fact that we have our physical audience here, and we also have online participants. We do offer a resource hub, and that, if you scan the QR code that is at the end of the screen, that will take you right to our website. And there you have information on the various pathways. So for IMGs, that pathway, you have quite a bit of resources there, and we're updating or adding information to it daily. Now, next. The whole purpose here is to, of course, increase awareness of the IRCC funded resources for ITPs in Canada, guide or IHP groups in accessing those resources, and of course, highlight regional and national support networks that are available. So regardless of where you are in Canada, of course, I hope that you will find the content that we deliver here today useful, and that you'll be able to connect with an organization that is close to you or within your space and is able to facilitate you integrating. Now we have a lot of numbers here, right? So you're seeing $27.1 million annually toward IHP integration. And this was envisioned since 2005. Now, in 2022, the government of Canada dedicated $115 million towards ITP integration, or IEHP specifically, integration for IEHPs in Canada, with an additional $30 million in ongoing support. Now, in order for organizations to benefit or become eligible for accessing this fund, they had to, of course, write a proposal that reduced barrier to help in reducing some of those barriers to foreign credential recognition in Canada, provide IEHPs with Canadian workforce experience, or facilitate labor market mobility between the various Canadian jurisdictions. Okay, so those are the three key things that of course, you had to have in those proposals. And I'm giving you all of this information because you have those various circumstances. So when I say this is the organization you go to because they were funded, you know exactly why you're going to them. The resources are there for you to access under those agreements. Now, there's also other criteria that must be met. Of course, you look at things such as development, testing, and implementation of credential recognition system. And there was also a pilot project which started in 2022. I think Achieve was a part of one of those programs where the government of Canada funded community-based organizations for up to $2 million to say, okay, let us see if we should incentivize the process for employers if they will take on these IEHPs that are coming into Canada. All right, and of course, I believe, well, that program is on its final leg right now. So yes, we should be, of course, seeing what the outcome of that project is whenever the project closes. So in terms of the resources that you will predominantly find from these organizations, you look at language and communication support. And in terms of language and communication support, you have English language training courses or workplace communication programs, OSLT, and our first speaker earlier today spoke to those English-based programs that are accessible to use. OSLT, that is occupation-specific language training program. So you will have that specific for the healthcare sector. All right, so you can get, of course, some cultural orientation or sensitivity training where healthcare practice or the healthcare workforce in Canada is concerned. There's also networking and workforce integration, and with that, of course, professional mentoring sessions, activities like these that we're having today, events such as job coaching that you will have as well with those community-based organizations. There's settlement and social support. And with that, you will be able to access things such as residency, help with your residency applications. So you have your PR applications that you need to get done. You go to these community-based organizations, and PCAS is here. I think they have programs like those as well. They will provide those kind of support for those applications. Refugee claimants, if it is that you need support where those are concerned, you're in a financially unstable positions, and it may be very expensive, $5,000, $6,000 to find a lawyer, but you need to have your case heard, all right? You have these community-based organizations that will support in those settlement or provide those settlement and social support. Health and well-being is also one of those, and you'll see that grayed out because not many organizations do offer those support. And even for the ones that do offer, they tend to be quite dedicated just to offering that. But the others that we have, of course, sector-specific resources for the IEHPs, and that we are about to get into. Now, for the successful projects for our IEHPs, I'll have Saida take over. She's going to be speaking to you about.
Thank you, Dwight, and thank you so much for explaining in detail what these programs are and why is it important that we try to explore the options that we have through these programs. So firstly, I would like to talk about IMGA. It's an organization based in Alberta, and they provide a lot of services for international medical graduates, right from the beginning, like giving you orientation sessions and trying to understand what the licensure pathways are, and also helping you in exam preparation, CARMS preparation, and until even getting observerships with clinicians within Alberta. But they also have one program that I would like to highlight here is the Medical Communication Assessment Program. So this is funded by IRCC, which means it's available for people all over Canada. So what happens is these organizations, sometimes they are funded by IRCC or the Government of Canada. In that case, there is a possibility that people who are in anywhere in Canada can be eligible for the programs, and some are provincially funded. So most of the programs here, for example, the observership program or the mentorship program are provincially funded. So people who are residents of Alberta are eligible for those programs. But this medical communication assessment program, which basically gives support in assessing your communication styles and also getting support for the communication exams, for example, IELTS or OETs. So those kind of that particular program is available for people all over Canada. And they also have study groups, which I found very interesting because people from all over Canada, they come together and they do have a small fee associated with it. But depending on your situation, they also try to give a waiver if needed. And they all come together and form a study group and help each other out. So it's an interesting program as well. So I would really recommend everybody to check out. So this is the IMGA, and this is in detail. Oh, I'm sorry, I forgot. Yeah, so this is in detail about all the available programs they have. You can visit their website, or even you can reach out to us if you need any connections with people from AIMGA. So we'll be happy to help you with that. And next is from National Newcomer Navigation Network, N4. And they have the Fostering Canadian Integration for IEHPs program. So in this particular program, they again give you orientation sessions on what are the different pathways available, and again, focusing on communication communication styles and what are the types of jobs available and how to cater your resume and your present portfolio in order to match the current job market. So they give all those kind of supports from N4, and they also have a very strong resource network where they have the latest updates regarding all the pathways, and they also have nice PDFs on the different pathways available for each profession. It's like a quick snapshot, and Andrew and Sahar are people who you can reach out to. They are very helpful. And so this is another organization that we wanted to talk about as well. And CCI World Skills. So in this, I wanted to particularly mention about Federal Internship for Newcomers program. It is a very interesting program because people who are newcomers to Canada can apply through this program to have a short-term internship, like it's a temporary work that you can get in federal government, which will also act as a very good network building activity within the federal government. So this federal internship for newcomers program, it can be, application can only be made possible through organizations that have collaboration, that have that particular collaboration. And CCI WorldScale is one of the 2 organizations that have that. So if you're interested in exploring job opportunities in the federal government, then this is something that you can try. And also they have a particular program for career transitions for doctors and health professionals. This is not IRCC funded, so you might have to spend from out of the pocket, but the services are really good, and they have a myriad of information and resources. And now I'll pass it on to Dwight to talk in detail about.
Okay, so I've been saying achieve a lot, right? That's because Achieve was successful in gaining funds from IRCC for 3 consecutive years. So 2021, 2022, and 2023. And the largest of that was the ACA project, Accelerating Career Advancement Program. That one was funded for up to $5.9 million. All right. And that is for persons who are newcomers who are in Ontario In order for you to access this program, of course, you just need to be a newcomer. You just need to be internationally trained. Once you fit those criteria, you can get a loan from Achieve. We have Shabana over there, and Shabana is our contact person from Achieve. The beauty about this is that you don't need a credit score. So you come into Canada, and even for something such as a soft loan that you will sometimes get from those banks, or they will tell you, okay, wait a few more months before we can lend you $5,000. But no, with Achieve, you can borrow up to $30,000 without a credit score. They also have another program which I find very interesting, the employment pathways in, so that's the employment pathways in Canada, health careers. So if it is that you are an internationally trained pharmacist, dentist, and there's also another one here. If you're among any of those group of persons and you would like to relocate to, say, rural Ontario or go to Alberta to, of course, while you're working towards your licensure, or even if it is that you want to, say, choose an alternative career pathway in health, they will assist you with relocation funding, get you a job, and assist you with finances for relocation to those areas. All right. And then there is the third program that they have, which is the Career Success for Racialized Newcomer Women. And the beauty about this program is that there is no bond that is associated with the program. So if it is that you participate in the program, they won't say, okay, we're going to restrict you to practicing here or practicing there, or you're bonded to this program for 2 years before you can do anything else. No, there's nothing, no restrictions with that program. So that is something that is really useful for newcomer women to participate in. Of course, if you are in the healthcare field and you want to venture out, you want some support, contact Achieve, and you have the information there for both their their loan program, which is Shabana, the EPIC program, and also the CSRNW program. Now, before I switch to our next one, I'd like to invite someone from our host sector partners, PCAS, to just tell us a little bit about the programs that they have. And let me tell you, they have a myriad of programs. Some of them, of course, will benefit you as IEHPs here, especially those persons living within the Mississauga region. And also for those persons who are IEHPs, they do have ITP programs as well.
Thank you, sir. Okay. Good afternoon. I'm Siobhan Shresh from Pure Career Assessment Services. I hope you guys got a lot of information about, healthcare sector today, and like which career path to choose today, right? So, Pure Career Assessment Services, what we are also a government-funded organization, and what we do is we have two different departments: employment services.
Conseillère en établissement, settlement employment counselor. And the good things that we are bilingual, so in French and English languages. That's great thing because we do have a lot of people, newcomers like who speaks French, and sometimes they are struggling to find the good information in French. So yeah, we do help with English and French too. Thank you.
And we have a various program currently running. That is, we have a enhanced learning training, ELT program, and we have digital literacy program for if you need to get any information, or you need to get trained for computers. And we also have CSRL, that's for customer service training program. You can find, if you need any more information, you can come to, you can get some flyers over there, right? So basically what we are doing, what we are here is to like provide you the services, provide you counseling, right? We might have services you are looking for. If not, then we can recommend to any other organization. As you can see that we are connected to various other organizations. The main point is that you are in our right hand, right? And if you need any kinds of services, you are more than welcome to connect with us.
Okay.
I want to just add one more thing. We are funded by IRCC and means we can help with all application, like PR application, apply for Canadian citizenship, or for example, Ontario Works. We do have this service too. Thank you and welcome.
Yes. All right. Thank you, Peel Career Assessment Services. Now, just to point out one thing that for these programs that we are mentioning here, the fact that they're funded by the IRCC and sometimes the provincial government as well, for the persons to become eligible for those programs, they must have sometimes like a Canadian language benchmark of 5 to 7, somewhere there about, depending on what the program requirements are. For the various programs, if you are in any gray areas about those eligibility criteria, those information were passed on to us. You can reach out to us, ask us for that information, and we'll be happy to send them to you. We will also be happy to connect you with the various organizations that we're presenting those information for here today. Now, the next one that we have here is SEED, and this is in Winnipeg, Manitoba. Now, for SEED, the funding here is still through IRCC, about $2.9 million in terms of loan and other employment support. All right, so for SEED, you have the contact information here. There's also a fact sheet that was sent to us for SEED. Again, you can get loans up to $30,000 for SEED from this program. There's just one thing I wanted to point out here with the interest rate, that you have some kind of information here about prime interest rate. So whatever it is that interest rate is for the central bank, then that is what they will take and then add 1% to it. All right, so if you have some gray areas there, you have a repayment term of 7.5 years for that. If you are internationally trained, you have your certification, you just need to go to SEED. If it is that you're living in Winnipeg, go to SEED, say to them, okay, I have these, I fit these eligibility criteria and would like to access the program. Contact information for that program is also here on the slide for your benefit. Let me say, for these programs that you're seeing here that are IRCC funded, all programs would have received an amount of greater than 500,000 Canadian dollars, up to a maximum of 10 million Canadian dollars, okay, for the lifetime of that project. So those are resources that you have at your disposal. Let's take a walk over to Vancouver, British Columbia. And here we have Immigration Services Society of British Columbia. Again, similar loans program, and their loans program is called Global Talent Loans. And it also has an employment service component to it. Now, there is something here about this ISS of BC that was particularly interesting to me. When you come into Canada as an internationally trained professional, you try to get into internship programs and co-op programs. But guess what? those programs are all closed to persons who are trained in Canada. And what you will realize as well is that for these internship and co-op programs, they are somewhat a feeding tree for those careers that you have within the workforce here in Canada. So if you want an entry-level position in healthcare, regardless of whatever your training is, you will find that you're going to be competing with someone who came through a co-op or internship program, and they're going to get the job over you. All right? So ISS of BC, they actually have a college that is this community-based organization. So they have a language communication college that offers co-op programs, internship programs, minimum of 48 weeks to 112 weeks. So can you think about all of the possibilities and the opportunities that you have engaging with this institution? So there you go, another resource that you can tap into as an internationally educated healthcare professional. Saido?
Thank you. So the next one is that PIGS organization. So again, this is an organization where you can avail loans for your career progression. And this is located in British Columbia. So the services are local to British Columbia, and they give loans again up to $30,000. And one particular feature that I was mainly drawn to was, in addition to all the services that they provide, like for example, helping with your application and then helping you build an action plan towards your career progression. Towards the end, they also have a wraparound support services for women, particularly focusing on gender-based, in a sense, like gender-based issues women face and how to navigate that through the workforce environment. So that is something that was particularly interesting for me, and I'm sure it's reflected with many of the audience here as well. So maybe, so this is something that we can check into as well. The next one. And this is on Ottawa Community Loan Funds organization. So it's a community organization again, and they provide loans for up to $5,000 for a maximum of 12 months. So it's a relatively small amount, but this can be utilized for smaller expenses, like for example, any application process or any exam application or exam completion, all that. And they also provide training loans. For example, if you have any small workshop training and that you want some support for a minimal period of time, you can avail their loans as well. So, and this is, again, local to Ottawa region. Let me just check. Okay, I'll pass it on to Dwight.
Okay, so the next one we have here is Windmill. And for Windmill, that is a loans program again. And this program is IRCC funded, funding in 2022 for $8.4 million. Now, this is a pan-Canadian organization, and as long as you're an internationally trained professional, you can access this program wherever you are in Canada. With this also comes other support services, such as employment support services. So if it is that you access, say, the loan for a specific purpose, and then you realize that your career pathway is also going off track, you can also reach out to whoever your loan support officer is, and they will provide career advice and counseling to help you, of course, make things a bit better or smoother in terms of that whole transition for you. You have the information there for Windmill, and you should be able to contact them via the information that you see there on screen. We have Oneness here with us, and with Oneness, they are now rethinking the way that we integrate into our professions in Canada. So for the international medical graduates, the dentist and the pharmacist and the nurses. And you come into Canada, you hear about all of these expensive programs that you must do, these expensive exams that you must do, and expensive societies. And I keep saying expensive because they are expensive, right? So they have been rethinking the way we fund all of these expenses for IEHPs who, of course, may face financial vulnerability. And a way that they have envisioned this is to use crowdfunding. So if it is that you have exam coming up in June, you're not able to pay for your exam, you're a member of Oneness Education Foundation, then they say, okay, let us pay for your exam that is coming up in June, and we'll put you on a payment plan. You're gonna pay back for the cost of your exam, of course, without interest. Don't you think that is something really wonderful that all IHPs would benefit from? If it is that you want to also participate in a bridging program and it's a partnership that they have with that specific bridging program, you are financially challenged for whatever reason, they will also offer support where that is concerned. So of course you can participate in those integration programs that you need to get to where you need to get to. We have the information here for Oneness on screen, and they also have a table here. I hope you did interact with them earlier and get some information from them about their programs.
The next one.
Who is this?
That's okay. It's okay, we were just having a discussion. So ISENS is Immigration Services Association of Nova Scotia. And they have a lot of interesting programs, both pan-Canadian and also local for Nova Scotia residents. So this is again a loan service, which is for up to a maximum of $15,000, but only for people within the Atlantic provinces. It's called Atlantic Immigrant Career Loan Fund. And we have our contact person here. So if you're interested, I'm not sure if anyone's here from the Atlantic provinces here or planning to go to Atlantic provinces, because ISENS have a lot of very, very interesting programs who are local to Nova Scotia. And they also have a lot of bridging programs, but again, they are funded by the provincial government, so they are available only to the residents of Nova Scotia. And this, I'm sorry. So this program, which is National Healthcare Language Program, which is recently funded by IRCC, and this is again pan-Canadian. They have two courses. One is for nurse and other for medical graduates and pharmacists. And both courses are very in-depth, and they're both blended, both in-person and online versions are available. And in all these courses, they take you from, I mean, you will have to have a basic language requirement, but then they take you through the courses that help you get eligible for your licensing exams and also for your workforce integration. So this is again pan-Canadian, so anybody residing in any part of Canada can avail these services. And we have the contact person for that one as well, Olha, for this particular program. And next is COSTI. Again, this is a language enhancement program. They also have blended and online support, and they're mostly located in Peel region and York region, mostly around GTA area. And they also provide job search support. So this is a community organization. So they do have a local arrangement. And yeah, and they're a very nice organization you can get in touch with. This one, I believe we have a dentist here. Yeah, so they have a very interesting program that was launched like a couple of years ago. It's for internationally trained dentist support program. So they give you all the support from initial assessment, also walking you through the exams, and also getting your final certification. They have orientation and learning sessions. It is again blended, both online. The final assessment has to be done in person in Alberta. I believe the initial services can be availed from any part of Canada, but the final session has to be done in person. So I just found it very interesting because this was one of the very few programs that was particularly focused on dentists. So I thought I should definitely highlight that. And this one, it's a nurse ready. The program is called Nurse Ready from Touchstone Institute. I found it very, very interesting. Touchstone Institute has a lot of programs, particularly focused on communications. And this is, again, a communication self-assessment program. It's an app. I think you can all even check that out now. It's both available on App Store and Google Play, and it's available free of cost for everybody. They have particularly focused on nurses, but I believe that all healthcare professionals can go through that module. They have a lot of different situations and how to navigate. They have example answers, and you can record your answers and check if your communication style is in par with the Canadian standards established here. Again, this is available free of cost. So I thought, this is a really great source for people who are trying to understand the differences in communication pattern here in Canada. They also have other programs like communication through simulation program, where you go attend in person. However, it has to be paid out of the pocket, but this is something that we can all avail without any cost. Okay, and this is PCPI Working Together for Progress. This organization is, again, mainly particularly focuses on IENs, internationally educated nurses, and they provide support for nursing licensing pathway. So this is somewhat in par with a bridging program for nurses. So they take you through all the steps and also through the nursing until the nursing licensing exam. And they have a third cohort that is going to start on December 9th, and the applications are open. So if you or any of your friends are interested in this, they can very well apply. Again, it is IRCC funded. So if you meet the eligibility criteria, then probably you can get into the cohort and get through the program. And they also provide loans if needed for people who are going through the pathway when you're in the cohort. So that is, again, another community support they provide. This is HMC Connection. It's a Halton Multicultural Center. This program, they have a program that's very unique here because they are one of the few, almost the only program that I was able to see that was focused on people who have CLB English level 0 to 4, international healthcare professionals like myself. For us, English or French is not the primary language. So there are people who find it really difficult to go through a lot of communication programs that are available, which have a basic level in, for example, IELTS score or CLB score. But they have a coaching support for people who have English level from 0 to 4. So I thought that was very interesting. And they also provide tips for a job application or interview, anything along with your work application. I believe this is Dwight's slide here.
Okay, so I'd like to talk about CARE. And again, this is for nurses. The beauty about this program is that they help with pre-arrival support as well for nurses. For nurses who wants to come into Canada, there is that support. Also licensed practical nurses as well. So those are the two specific groups that they cater to. They offer services that encompass licensure process and workforce integration. So if it is that individuals need support with job applications, job readiness, activities, anything along that line, they offer those, and that program is funded by the IRCC and the Government of Ontario. Now, the program is both virtual and in person. So if it is that there are persons, of course, in remote Ontario and would like to access this program, they can still access the care program for nurses or licensed practical nurses. And the contact information is there for you. The other one is also a little bit unique. This one is for self-identified women. And these are individuals who are just starting their foreign credential recognition process in Canada. The beauty about this program is that it also helps provide those social support as well for individuals who may be going through that immigration process. So if you need PR applications or citizenship application or refugee claimant, they will help you with those while also helping you with job placement, which aligns with pre-arrival experience. So if it is that you were a nurse, they'll help you from pathway, the entire licensure pathway, and helps to get you into nursing. Or licensed practical nursing, help you through the pathway, and of course, get you certified in Ontario to practice. And the information for young women of Toronto, and then there's also Metro Vancouver, is there for you if it is that you need to connect with them, or you can reach out to us for additional information. We're wrapping up. I know we are right about that time. We have been speaking about language a lot in the presentations that we've had. Communications, how you speak, either generally or within the healthcare industry, or just simply going for a job. So we look at some statistics here. A total of 72% of immigrants reported having mother tongue other than English or French. And those are the two languages that are recognized in Canada. So when you look at that number, we can't overemphasize the need for English language training programs or those English communication circles that you will find at those community or social support organizations that are available to you. I encourage you to engage in them. Among recent immigrants, 76.4% reported knowing more than one language. So is it that English or French was one of those dominant languages? Not necessarily. Those persons who know multiple languages, they may know 3 languages, but still, you don't know English. And as skillful as you are in your language, you understand when you come into Canada, those exams or assessments that you are doing, they're all in English. You understand? You know what you're doing. I know what you're doing. You understand? But when you sit to write that exam in English or French, can you confidently display on that exam or assessment that you know what you're doing? Not necessarily. So I do encourage you to engage in these programs as much as possible. They're available to you and accessible to you. You can find them a lot in the colleges. We had Niagara College with us earlier today. There is also George Brown College, Seneca College. They also have those OSLT programs. Engage as much as possible with them, and as well in those English conversation circles that you will find in the community-based organizations. 25% of the Canadians that you will find today speak a language other than English or French as their mother tongue. Yes, we all need this for diversity. So you will go into the healthcare practice, and you will find it's a challenge to communicate with the patients that you're seeing because they may speak, say, Arabic, or they may speak Hindi. But guess what? The language of care is English, and they don't understand, and then you have that communication barrier. So yes, your mother tongue may become very useful there, if it is that you're able to connect with those patients. But still, you need to engage as much as possible to get a hold of the English and the French, whichever applies to your situation. So we close with a call for action to our healthcare institutions that are in Canada and wherever else it is that we have our participants that are joining us, and to those persons who can make the change, just to rethink some of those hiring practices that we have within our healthcare institutions. We're asking for our human resource personnel or our human resources or recruitment team and Correctional Services Department of Canada. Thank you so much for joining us today. We did reach out to a lot of recruiters, but they take the bold step to join us to see what skills we have among our IEHP groups that could benefit the team, you understand? So we are asking for more human resources personnel in Canada to become more inclusive in their practices when they think about hiring, and also, of course, redesigning those bridging programs that we have for healthcare IHPs on a whole. We think of them as being expensive, you understand? And for a lot of persons, especially for our refugee IHPs who might find it challenging, of course, it's not just going to be challenging, but it's going to also be inaccessible for you. You're basically excluded from the profession by reason of this financial barrier. All right? So just those two things I want to close and leave with you. Things that we need to work on, things that we need to change in order to reach us. We do have our mentorship program. We do have our resource hub. That the QR code is on the screen there for you. You can scan them. Go to the mentorship page if you want to connect with our mentorship program. All of that communication will come to us. We'll respond to you from there. That was it. Thank you, everyone, for joining us. And to Janet for being our excellent host for this event. I would like to invite you to join us here. Just something to show our appreciation for your time and effort that you've taken. Okay, thank you so much.
Part of this beautiful day, I can't say enough about your dedication to your profession. I feel that you're already on the right path, and I just feel that you need to believe in yourself and make others see the uniqueness and the special talents that you have to offer to our Canadian workforce. Help us strengthen the Canadian healthcare system and address the critical workforce shortages. Hope to see you next time with your beautiful stories. Thank you.
Thank you so much. And to PCAS, our host, for allowing us to utilize your space for this event. We really appreciate you accommodating us. To our lovely volunteers that join us today, our Pegasus IEHP team is quite small, of course, and so when we look at our registration numbers, we had 240 registrants for this event with over 70 expected in-person attendees. So we thought, okay, as for such a small team, we will not be able to handle all of this crowd. We asked for volunteers, and there were some persons who, of course, stepped up to the plate. Miroslava and her daughter, I think they left a little bit earlier. Just please give them a round of applause. We really appreciate their support. Tommy is still here with us, and Oyinda, okay? And of course, Bina's, those three lovely ladies there in the back. for joining us and volunteering to support us. To our sector partners that are here with us, Oneness, Achieve, and of course, Correctional Services Department or Recruiter, we thank you for joining us today. And to our lovely guest, we couldn't have done it without you. Thank you for braving the obstacles, the challenges, and coming to join us for this wonderful event. As we close the curtain,
I would also like to extend our thanks to our lovely sponsor plus partner, Canadian Medical Foundations, and they have been very, like I said in the beginning, they have been very, very instrumental in supporting the entire project from the beginning. So our sincere, sincere gratitude to them as well. So thank you.
okay. Who are we? We're Pegasus. I'm Dwight Baker, Mentorship Coordinator.
I'm Saida Azam, Project Coordinator, also an IMG.
And I'm Mohammed Nashat. I support Pegasus Institute in two ways. I support Pegasus through my company, Baytech. So we developed the IEHP website. And I also support Pegasus in terms of the pharmacy pathway because I'm an IPG myself. Thank you very much all for attending. We really appreciate that.